Quiet down, please. Good morning and welcome to today's New York City Council hearing for the Committee on General Welfare. At this time, we ask to silence all electronic devices, and at no time is anyone to approach the dais. If you have any questions throughout the hearing or would like to sign up for in-person testimony, please see one of the Sergeant-at-Arms. Chair Ayala, we're ready to begin.
Good morning, everyone, and welcome to today's hearing. My name is Diana Ayala, and I am the Deputy Speaker of the New York City Council and the Chair of the General Welfare Committee. Today, we are holding our annual oversight hearing on hunger and food insecurity in New York City. We will also be hearing 3 bills. The first Intro 245, sponsored by Councilmember Hudson, is a local law that would require the Department of Social Services to report on the feasibility and creation of a universal benefits application for local public benefits programs. Next, Intro 1028, also sponsored by Councilmember Hudson, would require DSS to create a system to automatically enroll individuals in city-created benefits programs like Fair Fares NYC, and to notify individuals about this system, including how to opt out. Finally, Intro 1148, sponsored by Councilmember Caban, would require DSS to provide an application receipt to any applicant for benefits of service. Moving on to our oversight topic for today. Every year, the Committee on General Welfare holds a hearing on hunger and food insecurity, recognizing the growing challenges around these issues for too many New Yorkers. We know that poverty and food insecurity overlap, and we also know that people of color, as well as those living with disabilities and chronic health conditions, are more likely to experience food insecurity. Food costs have grown significantly since 2019. Pandemic-era supply chain disruptions, rising labor costs, increased operating costs, paired with high inflation, have made grocery prices volatile. Wages have not grown in line with inflation, and families are struggling to meet with their basic needs, including ensuring that they have access to sufficient nutritious food. Additionally, federal social safety net programs like the Supplemental Nutrition Assistance Program and Medicaid are at risk of significant cuts, which would make New Yorkers even more reliant on city programs like Community Food Connection. Already, the Local Food Purchasing Assistance Program and the Local Food for School Program, which provide federal funds to food pantries and schools to purchase food from local farms and ranchers, has been cut. The LFPA was used to fund the statewide New York Food for New Yorkers Families program, with organizations running food pantries and soup kitchens in New York City amongst its many grantees now facing a funding gap. I look forward to hearing from the administration and advocates today about the challenges faced by those who are working hard to feed New Yorkers in need, and ways in which that we can better collaborate to make sure that no one goes hungry in New York City. At this time, I would have acknowledged my colleagues, but they're not here yet. I'm sure that they will get here anytime soon. But I would like to acknowledge the committee staff who has worked hard to prepare this hearing: Sahar Mozami, Assistant Deputy Director; Nina Rosenberg, Policy Analyst; Julia Haramis, Unit Head; Elizabeth Childers Garcia, Finance Analyst; Ann Driscoll, Data Analyst; and finally my Chief of Staff, Elsie Encarnacion. I will now turn it over to Councilmember Hudson is not gonna, I'm gonna turn it over to the Committee Council to swear in members of the administration.
Good morning. Will you please raise your right hand? Do you affirm to tell the truth, the whole truth, and nothing but the truth before this committee, and to respond honestly to council member questions?
Yes.
Yes.
Thank you. You may begin when ready.
Thank you. Good morning. My name is Jill Berry, and I serve as the First Deputy Commissioner at the Department of Social Services. I would like to thank Deputy Speaker Ayala and the members of the Committee on General Welfare for holding today's hearing on hunger and food insecurity in New York City. I'm joined today by New York City Human Resources Administration Administrator Scott French. We appreciate the Council's continued focus on advancing food security for New Yorkers and the work that DSS and HRA pursue in lifting up New Yorkers' food security. If anyone listening is facing food insecurity, know there is help available. You can call 311 or visit foodhelp.nyc.gov to find nearby food pantries and community kitchens. Access HRA, our mobile app, and our benefits access centers serve as further resources where clients can apply for benefits. I also want to take this opportunity to encourage those clients receiving SNAP to learn more about the DOHMH food access initiatives, including Health Bucks, Get the Good Stuff, and Groceries to Go. All assist in strengthening a network of healthy food options for New Yorkers. Food insecurity intersects with many aspects of both individual and community well-being. From poorer school attendance and academic performance to poorer health outcomes, including depression, diabetes, heart disease, and other chronic diseases, greater food insecurity results in disparate impacts on low-income communities along multiple important dimensions of our community's well-being. This is why our city's ongoing efforts to serve as a strong partner in aiding food insecure households matters. Alongside DSS, our sister agencies and countless community partners serve as part of the safety net to assist food insecure households. Working with colleagues at the New York City Department of Health and Mental Hygiene and the Mayor's Office of Food Policy, as well as a panoply of community stakeholders including neighborhood older adult centers, our houses of worship, and community-based organizations, we work to tackle the challenges food insecurity presents. The Department of Social Services is responsible for administering programs crucial to uplifting food security. The Supplemental Nutrition Assistance Program, SNAP, helps approximately 1.8 million New Yorkers access nutritious food, including approximately 550,000 children and 545,000 older adults. The Community Food Connection funds more than 700 food pantries and community kitchens across the 5 boroughs. CFC served more than 21.5 million people, that's a duplicated number, in FY25 from July 2024 through December 2024. The CFC model has created added flexibility for providers to distribute the mix of foods that best meet the needs of the communities they serve, including fresh produce, halal certified proteins, and kosher certified foods, among many other options. Formerly known as the Emergency Food Assistance Program, or EFAP, CFC received $57.2 million in funding for FY25. From July 2024 through January 2025, CFC has distributed more than 22 million pounds of food. The federal government is a crucial pillar in advancing the food security of our communities and communities across the country. That is why we continue to monitor developments in Washington, D.C. closely and continue to underscore the importance of the Farm Bill and SNAP. Proposals for federal cuts would have profoundly negative impacts on vulnerable households. The House plan contemplates eliminating $230 billion from agriculture funding, which would severely impact SNAP benefits for New Yorkers. Any reduction in SNAP would have a significant impact on New Yorkers who access our and other essential food security programs. To be clear, neither New York City nor New York State have the budget capacity to replace crucial federal funding. We encourage the City Council and all stakeholders to speak out on the importance of these crucial tools for fighting food insecurity. These programs need to be retained and augmented. Instead of a conversation centered on cutting these vital programs, we would like the federal conversation to lift up the lived experiences of these vulnerable households. Moreover, understand the multiplier effect SNAP has in our communities. The U.S. Department of Agriculture has estimated the benefit of every dollar used to assist households with SNAP, finding between an additional positive 80 cents impact to $1.79 impact on our community. That multiplier effect supports employment, helps local businesses, including local supermarkets and bodegas, and contributes to a stronger, more resilient economy. We would also like to draw the Council's attention to a proposal within the Farm Bill that deeply impacts food insecurity in New York communities. The Thrifty Food Plan is the model used to determine maximum SNAP benefits, from a holistic approach that accounts for fundamentally important factors in determining benefit levels, such as food prices, dietary guideline changes, and purchasing habits. The House plan proposed doing away with the Thrifty Food Plan. Without a Thrifty Food Plan that includes those components, we lose a crucial pathway for regularly updating SNAP benefits. In addition to the annual cost of living adjustment, the COLA, the Thrifty Food Plan provides a key avenue for regularly accommodating the real needs of households. Elimination of the Thrifty Food Plan would result in $30 billion less in SNAP benefits over 10 years. We appreciate the Council's partnership in advocating for New York communities, and we would like to draw your attention to the timeline of expected federal budgetary action. Foremost on that timeline are the April presidential FY26 budget release, the July House and Senate FY26 appropriations bills release, and the September 30th deadline for Congress to pass FY26 appropriations or a continuing resolution. Your ongoing advocacy is needed to ensure we secure an all-important pillar of protecting New Yorkers' food security. Outreach remains an essential component of our work, upholding our obligation to both make assistance available and make New Yorkers aware that the city serves as a partner in food security. To that end, the DSS Office of Community Outreach conducts targeted outreach campaigns to organizations serving specific populations, including older adults, the LGBTQI community, persons with disabilities, and immigrant communities. The Office of Community Outreach conducts presentations and attends resource fairs, farmers markets, and other events to increase SNAP awareness and engagement. In addition, DSS works through various channels to educate the public about SNAP benefits, to maximize the city's use of available federal programs, to increase the purchasing power of low-income New Yorkers. Office of Community Outreach also provides SNAP trainings and presentations, pre-screens potentially eligible applicants, and assists with the SNAP application process. As I mentioned at the start of my testimony, New Yorkers in need of assistance should call 311, visit foodhelp.nyc.gov to find nearby food pantries and community kitchens, or reach us through Access HRA or one of our benefits access centers. New Yorkers can also be connected to a community-based organization to get help with SNAP enrollment as well as other benefits by calling 311 or visiting the HRA website and clicking on the Find a Partner Organization section. In addition, DSS participates in monthly SNAP task force meetings chaired by Food Bank for New York City to provide updates and answer questions from participating CBOs. In 2024, DSS conducted a total of 80 trainings, which included 2,123 attendees, in using these tools to submit SNAP and other benefits applications and provide benefit case management via Access HRA. Training attendees include staff from other municipal agencies, community partner organizations, including older adult center staff. These trainings were also a forum for questions and concerns from providers and advocates working directly with HRA and DHS clients, including older adults. With regard to the legislation being heard today, before the committee are 3 bills. Introduction 245 by Councilmember Hudson proposes a report on the feasibility of creating a universal benefits application for local public benefit programs, and directive to develop a universal benefits application as determined feasible by the Commissioner of the Department of Social Services. This bill would also codify Access NYC, which is a screening tool for public assistance programs, direct the incorporation of new and existing programs as deemed possible, and require increased public awareness efforts of such tools. Introduction 1028 by Councilmember Hudson proposes that the Commissioner of Social Services create a system to automatically enroll individuals in city-created benefits programs like Fair Fares NYC. Introduction 1148 by Councilmember Caban would require DSS to provide an application receipt to any applicant for benefits or services. We appreciate the goals of easing the benefits application process, reducing the administrative burden placed on applicants, and offering clarity to applicants as to documentation required in a timely fashion. However, DSS is obligated to adhere to the rubrics set out by state and federal authorities governing applications, enrollment, documentation, and timelines. For instance, the USDA Food and Nutrition Service, FNS, has been specific about what our website looks like and what is permissible and impermissible with respect to application submission. For example, names, addresses, and signatures. Next, given the multitude of benefits HRA administers, not to mention other city benefits administered by other agencies, it is difficult to see the nexus between those diverse programs that would create a common application that is streamlined to support efficient application and assessment. Certain programs, such as Medicaid, may require protected health information to be submitted that is protected by state and federal confidentiality protections. Additionally, the federal government closely monitors and protects the use of information submitted in support of a SNAP application. State and federal privacy laws currently bar us from sharing data across certain agency databases without authorization. Those privacy considerations preclude certain protected information from crossing certain boundaries even within DSS, let alone aggregating sensitive information about individuals' residence history, income tax payments, or earnings histories on the scale required for automatic enrollment. Lastly, these bills would substantially impact the processes and workflow DSS uses to assess eligibility, process applications, and make a determination on an application. Providing a receipt and copies of documents submitted may seem like a simple request at first. To the extent we can, we are providing receipts. For applicants using Access HRA, a receipt which shows the date the application was submitted is made available upon submission of the application. For a client who comes in person and applies for benefits, a receipt is made available upon request. Our goal is to keep clients informed throughout the application process. This includes, when possible, making them aware of what documentation is outstanding in cash assistance and SNAP applications, for instance. In other applications we handle, this receipt and copies mandate is much more complicated, such as for Medicaid applications where a caseworker is conducting a home visit for a client with a medical or mental health condition or disability. The caseworker will not have the ability to print a receipt, nor will they be able to scan and provide copies of submitted documents while visiting the client in their home. In many cases, the documentation would need to be mailed to a client once submitted. There are significant privacy concerns, especially as it relates to sending personal health information in the mail. Such information could be varied as Social Security numbers, lab test results, diagnostic information, notes from healthcare providers, referral and discharge summaries, prescription details, or information about health conditions. If such documents get into the hands of the wrong person, they could be used for nefarious purposes. Our work to combat food insecurity, and more broadly, as the largest social services agency in the country, would not be possible without the ongoing generosity, partnership, and commitment of countless fellow New Yorkers. Thanks is also due to the tremendously hardworking staff at DSS, HRA, and DHS, and all across government and our community partners who dedicate their lives to uplifting the most vulnerable. We appreciate the General Welfare Committee and the Council's ongoing contributions and look forward to working in partnership to continue that work. We also appreciate the opportunity to testify and welcome your questions. Thank you.
Thank you. I want to acknowledge that we've been joined by council members Caban, Aviles, Osei, and Ong. And I will now turn it over to Council Member Caban for her remarks.
Is that on? There we go. Thank you, Chair Ayala, for the opportunity to speak today about Intro 1148 of 2024, a bill that I introduced to improve transparency and accountability in our city's benefit application process. This legislation would require DSS and HRA to provide applicants with a receipt whenever they apply for benefits or services. For years now, chronic underfunding and understaffing under the Adams administration has left our city agencies inadequately equipped to meet New Yorkers' everyday needs. And as a result, when they try to access life-saving benefits, our residents have struggled with bureaucratic hurdles and systemic barriers that have resulted in unnecessary delays, confusion, and rejections. That's why the Receipts Act would require each applicant to get a receipt with important details, such as the date of the application, a list of the documents submitted, a copy of the application, and an explanation of whether the application is complete or if further steps are needed. This simple but ultimately very important step would help to ensure that New Yorkers facing some of the most challenging moments of their lives can navigate the process with greater clarity and confidence. And the testimony we're going to hear from advocates and organizations today who serve populations that rely on these services will demonstrate clearly that this bill is not redundant. It would streamline and expand the mechanisms that currently exist for transparency in the application process. And crucially, this bill would fill important gaps in the application process, strengthening these mechanisms and guaranteeing greater confidence among applicants. Our constituents need this, and I look forward to working with DSS to address their concerns about implementation and make the Receipts Act work for our community. This bill is about making sure our constituents can access the basic resources they need to survive. So I hope you'll join me and the 24 of my colleagues that have already signed on in supporting this important measure, one that will ensure our neighbors are treated with the respect and dignity they deserve when applying for critical public benefits. And I hope we'll be able to work collaboratively with the department to make sure it is implemented effectively and helps plug the existing administrative gaps in our city's essential social welfare system. Thank you.
Thank you. Okay, I'm going to ask a few questions and then I don't know if any of the council members wanted to ask questions, but you should probably, okay, great. Good morning. Can you tell us how many providers are currently in the CFC network?
We currently have over 700 food pantries and community kitchens in the CFC program across the 5 boroughs.
Are those providers given a set of food grant allowances per month or per year?
We do 2 allocations for 6 months each, and providers have the flexibility to spend the allocation during that 6-month period as works for their program.
How do you determine how frequently the grant is provided?
I'm sorry.
So you're saying that you give the allowance is granted every 6 months?
One allowance per provider every 6 months, so 2 per fiscal year.
Okay. So how do you determine that?
We primarily rely on the supply gap analysis that we run that looks at what is the supply of food in the neighborhood and what is the relative need of food in the neighborhood. We have also taken into consideration unemployment rates, the presence of vulnerable populations in particular neighborhoods, such as recipients of SNAP, recipients of cash, for example. We take into consideration the task force on racial inclusion and equity neighborhoods that have been targeted for needing additional services. We took into consideration in the last round of allocations the reduction in SNAP benefits. So during COVID, SNAP benefits were set at an elevated level, and then they came down at the end of COVID. So we looked at those neighborhoods where populations had a larger loss of SNAP benefits during that time. And lastly, we took into consideration neighborhoods that had large numbers of new emergency shelters that were sited in the neighborhoods, and we gave an extra allocation to those.
So for those communities that don't benefit from brick and mortar locations, do the few organizations that are, in the program, do they receive more funding?
all the providers that are in neighborhoods that have these criteria get slightly more funding than,
Okay.
it's weighted a little bit higher to give them more funding when they meet these conditions.
Okay. And if the CFC providers need more food than they have been allocated, what is the process and the time frame for them to get an approval to order more food?
So any community food provider that needs an additional allocation should reach out to the CFC program to let us know that an additional allocation is needed. We recently we had an additional $2.9 million that was allocated through OMB to the food program. Last month, we distributed $2.5 million of that funding, specifically to pantries that were still had a high supply gap and had spent all or most of their allocation so far. So that was I think it was about a third of the food providers got an extra allocation last month. We still have another 400,000 plus any other additional unallocated funds that we will reallocate to pantries in need next month. One of the criteria we're looking at is any food pantries that lost federal funding due to federal cuts so far. That has not affected the CFC program yet, but we know it has affected some pantries, and we're going to look to see what we can do to assist those pantries in particular when we do a reallocation next month.
So, just to get clarity, and thank you for that, what is the time frame from the moment that the request is made to the time that it is approved?
So
More or
we
less.
don't.
I mean, I'm assuming it varies, but.
Yeah, honestly, that's not, it doesn't typically work that way. We don't typically get a lot of requests from food pantries for additional allocations. They are familiar with our cycle and reallocation process. They know that at the end of an allocation cycle is typically when we do reallocations. And so we may hear from a few pantries that reach out to us at that time and say, hey, we know it's getting close to the time you do reallocations. Please keep us in mind as you do that. It's not I understand what you're asking,
Yeah.
but it has not traditionally followed that formal process.
Okay. Can you tell us what the CFC is doing to connect with and support smaller and newer providers?
Sorry,
What is the CFC doing to connect with and support
yes.
smaller and newer providers?
Yeah, so we do feel that it is really important to be able to support all types of providers with the CFC program. We support large providers, medium-sized providers, as well as small pantries. And the way we support that is we have an open application process. The application process for CFC is always open on a rolling basis. We do keep a small set of funds aside so that we can fund new pantries in the program at any given time. And every pantry application we receive, we work with that pantry to try to fund them. One of you have to have safe places to store foods. If somebody doesn't have that, we'll do a site visit to talk to them about, well, maybe you could put a refrigerator here, or there's this other location nearby that maybe could help out. We also require that CFC is not the only funding source for the pantries. So CFC is meant to be a supplemental program. It's not funding the full needs of every pantry in the city of New York, but we may work with them to let them know what the New York State application process is so they can apply for both sets of funding at the same time. We can coordinate and ensure that that pantry gets opened. Really, the only reason that we would reject a pantry application is if they're not working with us, for one, but that's not typically the case. But if there's already a couple of pantries like on the same block, that might be a reason that we might not fund a particular pantry.
Is there a minimum to the amount that you expect an organization or a program to have in foundation funds before they can be approved for a grant?
No, there's no set minimum amount, but it would obviously, we try to use our best judgment there. A dollar of funding would not be enough, but there is no set amount because we know pantry sizes vary, the number of hours that they operate vary, the number of people they serve vary, so we don't want to be too prescriptive in setting a minimum.
Yeah, I just worry for this because the smaller ones may not have the administrative capacity to, dedicate that time or staff to filling out applications, and so they may be relying, on the food bank, for instance, to bring food. And so if they're receiving some supplemental, program or service through like the food bank, for instance, would they still qualify?
That counts. If they're getting food through the food bank or through City Harvest, that absolutely counts.
Okay. Does the CFC offer any operational grants or assistance to help providers?
Yes, we do. We issue every year. We have funding for what we call administrative grants, as well as capacity building grants. So the administrative grant process is that has been our typical process in the past. Is the administrative grants process where we'll have unallocated funding from a prior year that we sort of hold aside for this purpose. Pantries submit to us receipts for funding, whether they bought refrigerators or hired a few staff members to staff a pantry, needs for food trucks. They provide us with their receipts, and if they meet the criteria, we will reimburse them. We've also recently, over the last few years, under this administration, in partnership with the Mayor's Office of Food Policy, have established these capacity building grants, which I'm very excited about because I think our administrative grants have benefited larger food pantries that can outlay money and then we reimburse them. But this capacity building grant process that we've implemented allows, I think, it makes it easier for smaller pantries to get some support for us. So this process, a pantry applies for what they want to spend the funding on. We evaluate those proposals that we receive, and then we provide pantries with the grant funding that then they can use that money to go out and purchase. Let's say a small pantry needs a larger capacity refrigerator. They submit that through our grant process. If they're awarded, they then have the funds to go out and buy the larger refrigerator, but they don't have to outlay that money themselves up front.
In fiscal year 2025's preliminary budget response, the council called on the administration to increase and baseline the CFC budget to $60 million to help combat the high levels of food insecurity in the city, which persists today. As of the preliminary plan, the fiscal 2025 budget for CFC totals $60 million. However, the funding dropped substantially to $20.9 million in fiscal year 26 and in the out years. This is a critical program for families in need. Will funding be added for this program, and if so, when and how much?
So we're really proud that this administration has more than doubled over the last few years the funding for the CFC program. It's an important program, and that level of investment that the administration has made over the last several years is unprecedented for the CFC program. And we continue to work with OMB on FY26 funding for CFC.
Okay. What is the actual spending thus far in fiscal year 25, and how much was spent in fiscal year 24?
Thank you for that question. In FY24, we spent $55.6 million on the program, and so far in FY25 through March, we've spent $29.9 million.
The fiscal year runs through June.
Yes, this is based on the receipts that we get from Schreier, so there is a bit of a lag in their billing us for the food that they have distributed, and then we reimburse them.
Okay.
We have traditionally allocated and spent all of the funds, and we fully expect to do that this fiscal year as well.
Okay. We're looking forward to the administration baselining those funds so that we're not having this conversation year after year. We've been joined by Councilmember Stevens. There are currently over 500 listed CFC locations. However, many of these are concentrated in certain boroughs and zip codes. How does the DSS ensure that CFC locations are funded in the areas with the most need, and how does DSS incentivize or otherwise support CFC providers in locations where there may be a mismatch between food access and need?
So the application, as I mentioned earlier, the CFC application is open all the time on a rolling basis for any pantry to apply. So any pantry in any location is can apply. If any council members know of a pantry not currently receiving CFC funds, we do encourage you to have them apply for CFC funding. But then the way we manage the food going into the neighborhoods is through the allocation process, looking at the supply gap. So we're really looking at the data of the need in a community and the capacity and ability to meet that need.
Okay. So we know that in some neighborhoods, they lack available brick and mortar locations, and that prevents providers from operating food pantries and soup kitchens. Does DSS have any idea on how this could be overcome, and how is DSS collaborating with other city agencies such as Aging or DOE to ensure access to food services?
So one of the ways that we are able to meet the need of the lack of the brick and mortar locations for CFC is we do fund some of the mobile pantries in the city. So there's a number of organizations in the city that have mobile pantries, and those pantries can deliver food into neighborhoods that may not have brick and mortar food pantries. And that's an important part of the CFC program that we will continue to fund. We also collaborate regularly with DOH, MH, and the Department for Aging to make sure that with DOH, MH, we work closely on a number of programs. They have a number of programs like Health Bucks, Groceries to Go, Get the Good Stuff that are available, that we work in partnership. They make available to people in receipt of SNAP benefits. And for the Department of Aging, we work very closely with them, especially and in particular on SNAP outreach to ensure that older adults who are eligible for and in need of SNAP benefits apply for and receive them.
Yeah, I think I'm primarily concerned here about, boroughs like the Bronx where there aren't very many brick and mortar locations, and that, the mobile pantry sites may not be enough. And so I know that I asked this at the preliminary budget hearing, but I'm really interested in hearing from DSS what conversations have been had with, the Department for the Aging to maybe increase pantry sites in some of their senior centers, or working with the DOE to identify locations within some of the schools to help identify, more locations that. Because I get it. I have a hard time, too, when I'm distributing my food pantry funds in the Bronx. There aren't that many people to give the funding to. So we rely heavily on, certain groups, which is unfair, right? Because, some of them are already at a tipping point. But I just haven't heard or seen, what the plan is to address this.
So
I like the mobiles. I just don't I don't think that the mobiles are it's complicated, right? People need to know, okay, I can go to, St. Anne's Church on Thursdays and, Tuesdays and Thursdays, and I'm gonna, be able to get what I'm gonna, whatever they're giving out that day. But with the mobiles, I'm not too sure how that works. My experience is that, they move around a lot, and so what has DSS done in the Bronx specifically to ensure that we're increasing the number of sites, because the number of funds that are going into the Bronx are significantly lower than that of Manhattan?
So understand your question. So what we have done since the preliminary budget hearing is with the $2.5 million that we allocated, over $1 million went to the Bronx. The Bronx got the largest share of that funding because they did have the largest supply gap.
And the highest number of poverty and food insecurity.
Yes, all of those things. And they did get the bulk of that $2.5 million. I just, in terms of the mobile pantries, I know that there are certain mobile pantries that specifically go to older adult centers and park outside of older adult centers on a regular day of the month and do have that partnership. But you're right, there is more we can do, and I will commit to reaching out to Department for the Aging and New York City Public Schools following this hearing to see what else we can do to increase to work with them to increase the the number of pantries or access to food through mobile pantries.
Yeah, I think it just, we need to be a little bit more creative about how we get food to folks. Because even if we're getting $1 million, we got $1 million extra, but the $1 million is going to the same, 3 groups. I mean, the outreach, you're not expanding, right? Because you're still meeting a need because it's significant, but there may be parts of the borough that are not benefiting from that. Okay. What is HRA doing to streamline the process? I'm actually moving over to SNAP. Can you tell us what HRA is doing to streamline the process and improve timeliness for public benefits applications, including SNAP, and what percentage of clients is HRA seeing reapply or reopening their cases after denial?
Sure, thank you. Currently, we do not have data on people who are new applicants who then reapply, given there's a variety of different reasons why someone might not have had the application go through the entire process. What we do track is for individuals who do not recertify, who are currently on benefits, do not recertify, and then reapply within 90 days. I can say for cash assistance on average, it's about 40% of those who do not recertify reapply, and for SNAP, it's about 25% of those who do not recertify will apply within the next 90 days and be found eligible. The reasons why people might not recertify can be a variety of reasons. They may not return the recertification form, they may not call for their on-demand interview, but the reason they are off the caseload is because we didn't receive information from them on recertification, not because we found them to be ineligible and then they were eligible again a little bit later. So we track that very closely to see if there's any trends that we're seeing as well, to try to identify if there's places where we can help, streamline the recertification process. I will say, as it relates to streamline and improving, access to benefits, we've spent a lot of time on technology, both utilization of Access HRA and ensuring as much as possible, especially around cash and SNAP, that individuals can really manage their benefits through that portal, as well as offering the on-demand interviews, right? So in essence, individuals don't ever need to come into a benefit access center if they don't want to. They also can and have get assistance both either using our PC banks if they don't have a computer at home. We have staff that man those to help people, as well as provide telephones if someone wanted to call for their on-demand interview in the center. And I can say wait times on average in January for cash assistance on demand, the average was about 53 minutes, and for SNAP, it was under 30 minutes.
So let me ask you a question, because I hear there's a lot regarding the, hold on a second. Just want to make sure that I recognize that we've been joined by Councilmember Riley. If a person has started the application process, they have 90 days to complete it?
No, the application process for timeliness, for timeliness for if you're an application, in general, there's a 30-day timeline from when someone applies, right? And in that 30 days, the individual would need to submit all necessary supporting document and complete an on-demand interview, and then we would be required to make a determination within the 30 days on average. There are instances where we will grant someone more than 30 days for the process. Say someone calls towards the end of the 30-day period for their on-demand interview, or they call and they need additional time to actually submit documents. We'll defer that application to give them more time to provide the information we need so that they don't have to restart the application process all over again. I can say that for timeliness rates, they have increased quite a bit over the last year, especially as we were able to eradicate the backlogs. So for SNAP timeliness for the month of January, that was over 91%. Cash assistance was at 71%, and we obviously continue to stay focused on ways in which we can improve, right, continue to improve those percentages. But
the percentages for cash assistance was 71%?
71%.
71%? Okay. Yeah, I'm trying to figure out, because one of the complaints and one of the things that I see a lot, through our constituent services division, is that people are submitting documents and then being told that the documents were not submitted. And sometimes my own staff is submitting the documents, so we know that the documents had in fact been submitted, and somewhere in the, abyss, they get lost, right? So then it happens pretty often, and my concern is that then they would have to start the process again at the 30-day mark, because there's no way of determining, right, that the documents were in fact. So if my staff doesn't call and say, listen, I have, like, I upload them, I sent them myself, there's no way that a person on their own can kind of prove, right, that they did that. And they're doing it sometimes upwards of 5 times. And, so there's something, there's a disconnect somewhere. Is there an acknowledgement, at least on the DSS part, and some sort of plan to try to figure out what that disconnect is?
Yeah, absolutely. There is a very high volume of, applications and recertifications that come through on a monthly basis. We're averaging about 48,000 cash applications a month, about 36,000 SNAP applications plus recertifications. So I'm not going to sit here and say that our indexing processes are perfect in any way. We continue to look at ways in which we can improve the indexing to ensure that documents that are, submitted are actually connected to the right case. We are rolling out technology, starting first on the SNAP side, where we are doing auto-indexing so that when someone submits some documents, it can be connected to that case. Right now, some of the indexing is, a person process and a people process, where there can be, incidents of, documents maybe not being connected to the right case. Obviously, in instances, where the council members bring those to our attention, we do research to try to understand first what may have happened, and then how can we address that moving forward. So, but we acknowledge it is a process that we're continuously looking at, given sort of the very large volume of documents that we are sort of managing on a monthly basis.
Yeah, I mean, we want to prevent people from losing their benefits, and we want to,
Absolutely.
Speed up the time frame in which they're able to access them should they need them. Is there a process within the system that alerts the staff when there's an individual that has maybe like a legal guardian, whenever like recertification? So I recently had a constituent case that I handled myself, and the person has serious mental health issues and has a guardian that handles all of their finances. And she was frantic because she didn't have any money to eat, and she had her food stamp card and she didn't have any money on it. When we called, what happened was that she lost them because she didn't recertify. So when I asked who did the recertification package go to, it had gone to her, but she has a guardian for that very reason. So I'm not sure why does that information get communicated to you guys? Is there a system where you're working within the networks for the guardianship program, so that you are aware of who's who to pay closer attention to, because they may have a specific circumstance that prevents them from filling out the application or recertifying on their own?
There is the opportunity for individuals to have sort of an authorized representative that works on their behalf. We need to look in that specific case to see what may have happened in that instance. In most cases, right, the information and such is provided to the individual. We are looking at ways in which we can try to, improve that sort of communication or track things. Through those who do utilize Access HRA and have accounts with Access HRA, right, they are able to see both, information on their recertification, right, when that's due, where that went, as well as documents that they submitted.
We're talking about an individual that has, I'm telling you, she has serious mental health issues, and
right.
And luckily, within her limitations, she's savvy enough to know that she needs help and come to our office. But I had a similar issue with her 2 months prior. She was delinquent in rent for like over $34,000. She has city FEPS. The city FEPS is about to expire, and she has a guardian that is responsible for all of this. But the information is not getting to the guardian, and the guardian is not communicating with you guys. So I'm trying to figure out, where is there a process, and maybe we can help you, I don't know, legislatively, I don't know if this is an internal thing, that, we can put in some sort of practice that ensures that doesn't happen. Because in her case, she doesn't get a lot of money, right? And so after her bills are paid, she has to still wait until, the rest of the money sent to her. And if she doesn't have access to food stamp benefits, then she's not eating. and she's may not be, in this case, she's able to self-advocate enough, right? Like, you have to be patient and sit there and kind of like try to decipher what she needs, but not everybody's that patient. I'll tell you that right now. Like, and most people would just be like, oh, this person has problems and we're not, like, we don't know what they want, and just, dismiss them. We need to create a better system when there's a person that is completely relying on you to receive their food stamp benefits every month, and they have a guardian. There has to be a network. Like, she's not gonna sign a paper that says, oh, I'm gonna assign X, Y, and Z to be my representative.
Yeah, in instances where there is actually a legal guardian for someone, and happy to talk more about specifics as well on that, because the legal guardian is responsible, right, for managing, right, the finance for that individual and making sure that they have everything, set up and, have access to the information they need. So would want to definitely look a little bit further into that, and happy to discuss further ways in which we can.
Yeah, I would love to be able to maybe brainstorm a little bit on how we can figure that out so that we're not, necessarily losing people. All right, I'm gonna just hand it over to my colleagues for a little bit, and then I'll be back. Councilmember Caban.
Thank you. I'm going to pick up where the chair left off, essentially. My first question is our constituents able to retroactively view submitted documents on the Access HRA mobile app?
They are able to see documents that they have submitted through their Access HRA account, yes. There is a PDF that is created connected to, right, an application that would show the documents that they did submit as relates to that application.
And so it shows what the document it is?
Yes.
Okay. So are there any special cases or circumstances in which an applicant might be able to view all of the documents online or on the mobile app outside of that?
You mean not having an application, but still being able to? To utilize Access HRA, individuals do need to have an account.
Okay. Obviously that poses digital divide sort of challenges. And it's true that, like, on the app, the documents are categorized, and the app basically only states what category a document was submitted under, correct? Right. So it doesn't actually tell them what the specific document they submitted that qualifies under a category, correct?
Correct. Documents get reviewed and verified through the processing process, as well as through the interview process, to identify, is there anything missing from the document?
So my point is that if what they are able to view on this is just the category and not the specific document they submitted to satisfy the category, which is a number of eligible documents, then they're all left wondering, well, which document was it? Was it this? Was it this? Was it this other thing? And I think that that's a problem. It's not particularized enough information for it to be really useful. At what point does the application or the participant receive a receipt or other notice about the status of their application, specifically about documents or next steps?
Sure. So individuals will receive notification after their interview if there are still documents required for the application to be completed, right? It will identify what is still needed from them, which is often when we'll also defer an application to give someone more time to actually submit all of the full documents, just because at initial application, individuals often may not have all of the documents that they need to submit at that time. So,
and also, to the chair's point, there are plenty of instances which we have many times in our office also. We also submit documents on behalf of our constituents where, the scenario is that we have submitted those documents and then y'all say you don't have them. So that also, like, encompasses what's happening some of the time. I want to also follow up on some of the questions around the in-person applicants that the chair was asking. So why is it that a receipt is only provided upon request? Like, doesn't that put it on the applicant to make sure that they're getting the verification they need? Doesn't SNAP as a federal program require a receipt by statute?
So we will, to start a SNAP application, actually an individual only needs to provide their name, their address, and they only have to provide 3 bits of information, which actually none of which would allow us to actually assess someone's application. That is under, the SNAP SNAP guidelines of what we are required to do. And then we would need to continue that by communicating with the individual on what is needed and through the interview. So, you know, currently we do have it on request, right? We can look at
Why?
that.
I guess like that doesn't answer my question. Like, why are we sort of shifting the burden here that like if you're meeting the person in person, the only way they get a receipt is if they ask for it? Why are they being treated differently than other folks? Presumably because if they're being seen in person, they have other, you know, barriers that make that the case, which already makes the process, a hard process, even harder. And like, I'm gonna say, as a person living with a disability, these are the kinds of differences in treatment that are like absolutely infuriating.
I hear you on that, and I will bring that back in regards to requiring individuals to ask for a receipt.
But you don't today have a reason or a rationale why that burden is shifted to individuals who are getting services at home.
I do not.
Okay, that's,
I understand you as
Problem.
well. I will also say, you know, an overwhelming majority of individuals are applying through Access HRA, where they do get receipts either on their own, or we encourage people to actually come into the centers to utilize our equipment as well. But I hear you on that instance, so
yeah, some
I will
people
take
can't
it
do
back.
those things. It's just, and then so you're taking people who are on the margins of eligibility in terms of need and making it even harder. And I think that's a real problem. I want to ask also, this is a little bit about, at following up on that, at what time in the application is the PDF you talked about made available to applicants? Like, are you talking about the ability to review the application at the very end, before, right before it's being submitted?
The PDF and the sort of receipt of it all will be after someone has submitted those documents. That's
Not
where
bef-
it would be created.
So not before, after?
Currently, yes.
Okay. I also am thinking about some of the testimony that you gave and have a couple of questions based on that. How does DSS currently receive documents? And this is I just want to get a lot of detail in the record about this. How are you receiving the documents from clients who are homebound or providing that verification when they do request the receipt? And then my follow-ups to that, because I know I'm running out of time, are like, you know, couldn't DSS scan the documents there and provide a paper receipt? I can't stress enough that these are our most vulnerable clients who don't have the capacity to do some of this online submission or submit the documents in person or by mail. And I think that there are absolutely ways to work around the privacy concerns that you have. I worked as an attorney for a very long time. I had to deal with HIPAA for a lot of my clients, and things that actually, and we would get excuses of like, well, we can't do this, we can't give you this because of HIPAA. And a lot of times it's like, no, I'm not asking for the information that falls under HIPAA. I'm asking for general information that would be useful without betraying that privacy. So yeah, that's my question. How are you doing this? Why can't you scan it another way? I'm curious to hear what you think, and I'd like to sign up for a second round.
Certainly. So first also I meant to say we as an agency are committed to working with you on the bill and working through some of the concerns we have to improve the ways in which we can absolutely make people aware of what they've submitted and where they are in the process, right? That is a goal of ours. It's a large system and it's an iterative process, but that is definitely a goal of ours, even with the concerns we have about the bill. And you know, as it relates to homebound requests, it sort of depends on each individual request, right? You know, I can get back to you on specifics for, you know, each of the different benefits that we have, just because we do some different things with different folks, but hear you on, you know,
But why
improving the
can't you
ways.
scan on scene, is again my question.
We could, I mean, the mobile app could be utilized on scene by individuals, right, to upload documents in that way. So that is something that we can do, right, to upload the documents, depending on if, you know, people can upload the documents not necessarily utilizing an Access HRA account, right? So those would need to be connected to an individual's account. So it's not always going to be connected, but there are ways in-home to upload documents.
And so just based on your testimony that you gave just now, it actually, it isn't the case then, in your, as you said in your written testimony, that it would be impracticable, impossible to provide receipts for these home visits?
I think the thing wasn't always just about receipts. I think it was also about copies of the documents, right? I believe that might have been part of it, but we can follow up. Each one would be different, right? A cash application is different than a Medicaid document.
It could potentially be scanned in a person's home through some means. That's
Potentially
not
that
what
we
was
would-
said in the written testimony. But I just want
We
to
would
name
need
that
to
there are-
work through it, so there are nuances and complications, but again,
Yeah.
we're committed to working with you to
Love to do that.
work through
Thank
those
you.
things.
Yeah, thank you. Sorry.
Councilmember Stevens?
Hello, good morning. I just had a couple of follow-up questions from when the chair was asking, and she was asking about the mobile pantries, because I just wanted some clarity around, like, and we can say specifically in the Bronx, because that's my borough, and even more specifically my district. Where are these mobile locations that you guys deploy the food pantries from?
The mobile pantries themselves, it's the organization that gets funded, and then the mobile pantries go to.
Yeah, which ones are you funding? Because I'm asking because the only mobile pantries that I've seen in my district are the ones that I fund. So I'm trying to find which ones you're funding and where are they located, because I literally only, the ones that I've been funding, this is the only time I've seen the mobile pantry in my district. So I'm trying to get an understanding of in the Bronx where those organizations fund it, and where are you deploying them or requesting them to be deployed?
So I know we fund Met Council Mobile Food Pantry. I don't know off the top of my head all the organizations that have mobile food pantries that we do fund.
Well, I'm just telling you, in my district, 16 in the West Bronx, the only mobile food pantries we have is mine. The ones that I fund specifically through the council funding, and that's a problem for me, especially because my district has little to no access to healthy and fresh foods. And so how are we going to the places where people need it? I know the chair talked about it's really hard to find people to fund even in my district for this, because there's just we don't have a lot, and even in the areas that needs to be funded, right? And so when I'm thinking about like High Bridge, there's a vacuum, there's nothing there. So I would love to see a mobile food there, which I fund because it is one, because I was like, this is crazy. Would love to see that. And how are you evaluating the information to make sure that you're hitting areas that have issues with food, access to food, and also have high poverty numbers? What is the evaluation process for that?
So we do recognize and understand that there are communities in the city that do not have enough brick and mortar pantries. We do fund some mobile pantries as a result of that, but
So my question is, so when you're thinking about the shelter placements, because my district is also overrun with that, how are you then countering that to make sure that they have the support that they need?
Currently, what we're doing is we're giving additional dollar allocations to the pantries that are in those locations that are participating in the CFC program.
So that's a problem. You guys are oversaturating specifically the Bronx with these things, and then not looking at how to evaluate to make sure you're offsetting the needs. And this is one of the things I talk about a lot, is that it's not that we don't want them there, you guys don't give us the support to be able to handle the amount of things you're putting there. And so I think that this is something you need to really take back and really be evaluating of, like, okay, we already have communities that have such high needs, and then we oversaturate it with more people who have not high needs, and then we're not giving them the services, and then we're kind of left to figure it out. And I guess my question, even around the health bucks too, I know you guys were talking about health bucks and partnering with DOH, and you are giving health bucks to organizations, because the only health bucks I've also seen in my districts are the ones that I fund. So I'm trying to get an understanding of where the ones you're funding, and how do my residents get access to that, because they're only the ones that I fund that I've seen in my district.
We'll have to get back to you because the DOHMH is the agency that gives out the health bucks. We partner with them to make sure that the SNAP recipients have access to them, but we can talk to DOHMH about how they.
Because I would love to know what that looks like, because again, in District 16, the only health bucks that are given out are the ones that I allocate from my funding. And if they're supposed to be able to get access to the health bucks, I want to make sure that my residents also are able to have access to these health bucks, because they love them. And I get yelled at all the time because I can't give out enough. Last year, because, you know, if you go to the farmer's market, everything is super expensive. And, you know, typically we can only give out anywhere between $15 and $20, and they are like, I can only get a bunch of carrots. So I would love to know if there's a place that I can recommend for them to go to support what I'm doing. But at this time, in the area of food insecurities, my district is super overburdened with it, and I feel like I'm drowning over here because I'm the one trying to pick up the burden. And if there's things that they should be able to get access to, I would love for my district to be able to get access to it. And I guess my last question is, one of the issues we have a lot with the constituent services is folks coming in and them being, you know, maybe $5 over the limit for SNAP benefits and not being able to get any benefits. What are some of the solutions that you guys give to them? Because I know a lot of times they come to our office, obviously we give them, you know, a list for like food pantries or whatever, but is there any other support? Because that's been a huge thing where we have, you know, families who do have jobs and working, and they have a number of children, and they're maybe like $5 over, and so they're not qualifying, and now they're struggling. So is there any other options that they may have?
Yeah, I mean, you raise a really good point, that there is definitely a benefits cliff for most of our benefits, and unfortunately we don't set the eligibility rules for most of our programs, including the SNAP program. They are set by the federal government, and we have very limited tools when somebody is just $5 over, for example, the eligibility limit for SNAP, other than providing them with information about food pantries and community kitchens.
Yeah, I know we don't set the eligibility for it, but my question was, are there other options, right? And so obviously I think that this is something we do need to address, especially with the price of inflation and things going up. It's making it that much harder because people have less money for food, especially when rent is additionally so high. And I mean, and just so fitting, my staff, as I'm sitting here, we're in the midst of participatory budgeting, and on one of our ballots, one of our young people just wrote, please give us money for food. So this is a real issue, specifically in my district, and this is at one of my high schools right now as they're collecting petitions. So this is serious for me, and it means a lot. And like I said, if there are things that my district is supposed to be getting, I have not seen them, and I would love to get more information on what that looks like to make sure that we can have access to it too, because I have not been seeing it or feeling it in District 16 at all. I feel like I've really been carrying like the food pantry burden on my own, so definitely would love some support and resources. Thank you.
Thank you. And she's entirely right. I mean, when we're trying to fund these organizations, these groups, like, you have to search, and you know, oftentimes when I represented parts of Councilmember Stevens' district, like, I would have to fund pantries that were outside of the borders of my own district because I didn't have any in that, you know, particular area, and I don't know that the people in my district knew, you know, to go that far off to be able to access it. So it's just, you know, we can work together to try to identify ways to make it better, but that conversation definitely needs to be had. I want to recognize we've been joined by Councilmember Banks, and I believe he has a couple of questions as well.
Thank you, Madam Chair, and to the administration, thank you. Quickly, just want some clarification on the SNAP program and the fraud issues that have come up. I know particularly there was a notification that went out that SNAP benefits wouldn't be, if there was fraud or somebody's card was breached, that they would have to wait a whole month to get back their benefits on their card. And I want to know what's being done. I had two seniors whose cards were compromised, and they had no food. Their card was compromised the first day of the month when their benefits were supposed to go on their card. and we had to basically run around to other food pantries to get them food. So what is being done by the administration to fill that gap, especially when we're talking about food insecurity? This just adds more trauma on especially a person or anyone. Shouldn't have to go through this. So what's being done to address this issue, understanding that the benefits won't be on the card until a month later? Who fills that gap?
Yeah, so thank you for that question, and it is really unfortunate that there are a number of bad actors that are preying on low-income New Yorkers in receipt of cash assistance and SNAP benefits and skimming those benefits from individuals' cards. Unfortunately, on December 20th, 2024, we lost the ability to replace SNAP benefits altogether. The federal government did not extend our ability to replace skimmed SNAP benefits after December 20th.
I'm aware of that. My question is, filling that gap, what are you doing to help fill that gap? Are you allowing them to go hungry? Is there any effort by the administration to assist these folks?
So the efforts that the administration are making are to, number one, advocate with the state to get to change the EBT cards to have chips in them, because that is the main way to protect needy New Yorkers from having their benefits skimmed in the first
What's
place.
the timeline for that to be accomplished?
We encourage you, we support the state legislation that would require the state to enable chip cards. That's Senate Bill 1465 and Assembly Bill 699. We support those bills. We encourage everyone to support those bills as well, so that the state will implement EBT cards, chips on EBT cards.
Are there any agency workers that reaches out? So if the individual says my card has been compromised, I have no food, is there agency rep that reaches out to provide them with resources or give them information as to where a pantry may be? I mean, the reality, there are folks that call the elected officials' office and there are folks that don't. And we don't want folks suffering in silence. So what proactive steps are you taking to help fill that gap while you're also dealing with, waiting for the legislation to take place? We're talking about, we don't want to add to folks' food insecurity and continue to traumatize folks. I want to know what steps are being taken to fill that gap.
And I understand your question, and there is unfortunately very little we can do other than to let people know about, to first of all protect their cards and try to prevent their benefits from being skimmed in the first place, providing outreach materials and other materials to prevent it in the first place. When SNAP benefits are skimmed, if it happens after December 20th, we are unable to replace those benefits. And for some individuals, food pantries and community kitchens are what is going to be able to backfill.
I'm not happy with the response of the administration on this. There needs to be you need to be much more proactive when we're talking about food and putting food in folks' mouths, especially when their card has been compromised. There's no fault of their own, and they're going without food. The administration needs to step up. And in that meantime, while their card is compromised, there needs to be information where they can go to the nearest food pantries, even if it's a door-to-door outreach that's being done where they're door knocking and they're doing another assessment to see what that particular individual needs are. But I'm not satisfied with the response of the administration on that, and I would urge you to do much more. Thank you.
I want to just piggyback off of that a second, because so there, in terms of like providing, extra additional funds, that is, that's complicated. We get that. However, nothing prevents the caseworkers assigned to specific cases where skimming has occurred to inform and provide those individuals with information to local pantries and places where they can get food. And I think that that is something that is pretty practical and doable, but it doesn't happen.
Yeah, and I do think that that is reasonable, and things that I can take back and make sure that if we're not already doing it, to make sure that our skimming website and any skimming denial forms include information about how to access food pantries and community kitchens.
Yeah, I mean, 'cause
again, that information may already be there, but if it's not, we can make sure that it is.
I mean,
going
because
forward.
in most cases, it's not preventable because people are going to the same supermarket that they've always gone to and having their benefits stolen. You know, I mean, when I use my debit card at an ATM, I like move it. I move it all over. I'm making sure that there's nothing in there because I've learned that through my precinct council meetings. But these are individuals that are actually going to their local supermarket, the same supermarket they go to every month to buy the same food, and then they look and they have absolutely nothing, and they're running very low on food if they have any. And it's an emergency, and I get that. So, I'll ask a follow-up question on the state part, but I would like to recognize Councilman Brown.
Thank you, Chair. I just want to follow up this EBT card scam, as you see, affects a lot of our districts. Is there any proactive steps that HR is taking to tell their clients about ways to prevent that? I know there's a way to unfreeze the app, and I know this is not the easiest for many people to use, but is there, in teaching also the clients when you go to the supermarkets to look out for these skimmers? So what proactive steps are you taking for the clients to make sure that, this stops happening month to month?
Yep, so we have, in particular this year, since we are unable to replace the skim SNAP benefits, we have re-upped our flyers, made flyers available to community-based organizations. All of our outreach and work in collaboration with the community-based organizations through our New York City Benefits Program and through newsletters, communications to others, we're making sure that we are providing flyers on the information. We're also working on some videos on how to use the EBT Edge app. And how to look for and identify skimming.
Well, thank you. Could you, is the videos done yet, or is still in progress?
I believe we're still working on those.
And if you're doing those videos, it'll be great to have them in different languages.
Understood.
Thank you.
Are you able to tell at this point? I mean, we've been discussing the skimming situation for a number of years now. Is there a way to be able to determine where the original skimming occurred? So if it happened at a local, at a, I don't know, whatever supermarket of your choosing, and it happened there multiple times, are you able to tell that, or are you just able to tell that a new card, where the funding was used? So if it was used in another state, or if it was used, upstate New York or whatever, that part you can tell. But are you able to determine where the skimming occurred?
The EBT information that we have access to is very limited. This is a contract that's held by the state, and the data is held by the state. So we have some limited access to the data, but we do not have access to all of the data. And the skimming doesn't always happen at the physical location where the person is using their card with a skimming device. Some of it is happening through, unfortunately, spoofing campaigns, phishing campaigns where people might be inadvertently providing information to bad actors that allows those bad actors to take their benefits. And in some cases, it might just be a coincidence that people are using the same grocery store over and over again, and that may not be how the bad actors are getting access to the data.
Wow. You mentioned that the DSS has been working with the state on, supporting these pieces of legislation. I mean, how aggressive are those conversations? Because the state can hold a bill for years.
We have communicated regularly with OTDA, and we can continue to communicate regularly with OTDA the importance of the need for chip cards. We're not just working through the New York State legislation.
Okay. Are those conversations fruitful? Like, have they been receptive?
I think that our partners at OTDA definitely agree with us that chip cards are necessary to protect benefits for clients.
I mean, I think we all agree that those are necessary. I'm just trying to figure out where the sense of urgency is in rectifying this, because it's probably more cost effective to just replace the cards than it is to have to replace the benefits. And it's inhumane to, remove that funding from the state budget while we still have not rectified the problem to begin with. So it's like we're like the dog chasing his own tail, at this point. I'm trying to figure out where we can be helpful in pushing, and I'm happy to, to submit and to, speak to my colleagues at the state, but I'm trying to decipher whether or not the conversations that the DSS has been having, with OTDA, separately have been, positive, and do you feel confident that we're moving in the right direction to, address this issue as soon as possible?
Yeah, I do feel that the conversations we've had with them have been positive and understanding this is the way in which we need to go. Just like at the city level, at the state level, agencies need to work through their processes as to how those things are approved and move forward. But we are not getting any sort of pushback on the need to be able to moving towards the chip, technology, and that is actually the answer to really address the skimming issue for everyone across the state. And I can say we're not the only locality advocating for this. All of the social services districts are equally advocating for a transfer to the chip technology to protect individuals and their benefits.
I mean, with all of the technology that we pay for, and, this is 2025. I would assume that would be something so simple. I'm going to allow Councilmember Caban a couple of more questions.
Thank you. I only have a couple more, I promise. I made it 3, 4. I want to ask again about the accessing the PDF in the application digitally. Where can that PDF be accessed? Is it, when you're doing it digitally, is it under the My Uploads tab, or is it like under the Case Records tab, or is it somewhere else?
I will have to get back to you because I'm not an expert on the system, so I don't want to misspeak as to where it is in the system. I'm also happy to set up a time for our teams to sit down with you and walk through, the system to show exactly where everything is. But I don't want to misspeak as to where it is or,
Okay.
Okay.
I will say also that, my team has sat down with y'all. It's actually how this piece of legislation was born, because of countless number of cases, countless number of meetings between our office and the agency, and there still was like a real gap that we were seeing. I also want to ask how long it takes for documents submitted by an applicant or a participant to become part of the case record, right? And also, to that end, does the length of time depend on how the documents were submitted to HRA?
So when we have documents that we are attempting to index, our goal is to index those as quickly as possible. Oftentimes trying to do it within, 48 hours. Sometimes it takes longer because of the volume of documents. So I don't want to, say there's a specific, because certain months will be a much higher volume than other months. But our goal is to turn that over and connect it to cases as quickly as we can.
Best case scenario, you can do it within 48 hours, but what are you also seeing as part of the practice in terms of the longer end of those becoming part of the case record? And again, that second question is, does it make a difference how the documents are submitted to HRA in terms of the length of time it takes for that to become part of the case record?
Someone, who submits through Access HRA, those documents could get to our indexing site, probably quicker than someone who does a paper document. But, I will say we monitor very closely if there's a number of documents that we're seeing where the number is increasing, and we'll redeploy resources to address that as quickly as possible.
And you testified what the earlier end is. What is the longer range of how long documents may be taking to become part of the case file?
I mean, I have not looked at all of the data, but I do look at the data regularly, and I have not seen it go longer than maybe 4 or 5 days at the very longest. I'm not saying that is the longest, but I do look at the report fairly regularly, and that is the outside.
If documentation is missing or unusable for some reason, right? Like, and examples I'll give are if it's illegible or it's blurry for some reason, how does the agency notify the applicant or the participant?
In reviewing documents when someone is doing their interview, we will identify at that point if a document is not usable, or they will be notified through, a notice that we require another version of a document.
Okay, and when you aren't with them in person and you're sending out a notice, do you explain exactly why that submitted documentation is insufficient?
The notice would indicate that it is needed, but I don't know that I don't believe it would necessarily provide the specific reason as to why.
That's
I know,
correct.
that's a problem. I mean, again, if they're not coming through our office and we're trying to figure it out together, or we're keeping our own records about what they've submitted, you got a person getting a letter saying your submitted documentation is insufficient, and they have no idea why. They don't know if it's because that document is the wrong document entirely. They don't know that it's simply they sent a blurry copy of the document. They don't know if, those are just like really, really simple things that would cut down the length of time between getting an application approved, which, to the stories that we've heard today, is like the difference between eating and not eating, the difference between keeping your home and not keeping your home. And these are just, to hear these reasons, which seem, like they could be pretty easy fixes, are like, when we have to tell our constituents who walk in the door that this is what's happening, it's devastating, and it's hard to do, and it shouldn't happen. I want to ask one more question, if that's all right. So there was data reported for local laws 168 and 170 that showed that a lot of case rejections or closures for both cash assistance and SNAP benefits were due to a failure to provide verification. So, for example, in Q2 of FY25, that's the October to December of 24, the data shows that 5,452 cash assistance cases were rejected because of failure to provide verification. And so this accounts for 16.5% of all of the rejections in that quarter. Have you guys reviewed this category of rejections to evaluate whether there are systemic fixes that can be implemented to decrease the number of those rejections?
We review the data as is to identify trends where we see things maybe growing larger than we have seen them in the past, to identify systemic trends. So I would have to get back to you on specifics as it relates to that specific data for that specific period of time. But we are consistently looking at, where we see rejection rates or specific codes that maybe are all of a sudden becoming larger, to try to identify what might be happening there, especially if it's something that's happening on our end. We definitely want to fix this, We similarly take our jobs and our responsibilities to New Yorkers extremely seriously, and certainly don't want to create challenges and difficulties for folks. Our system is large and complicated, and there are definitely places where we can improve, and we're committed to improving and continuing to talk with you about where are there places we can improve the way we provide documentation to individuals and inform them of what's happening with their application.
Well, I would certainly love a follow-up on what sort of conclusion y'all are drawing from, again, that as a specific example, because when I read that, what I am concluding is that there's a lot of people being rejected because they aren't able to verify the information they're providing in their application. That's a huge number of rejections. So I would hope to get a response on that. And thank you, Chair.
I want to recognize that we've been joined by Councilmember Ressler. Yeah, I see a lot of today's line of questioning as an opportunity to really work together a little bit closer to try to identify. Listen, I get it. Like the DSS is a big agency, and there are a lot of people that we're servicing, and there's a lot of opportunity to miss the mark, right? I don't think that it's intentional, but I think that it's really important that when we are hearing the consistency and where we're dropping the ball, that we're looking more closely at, at those areas. And, but I also want you to, to see us as partners, right? We're not just here to wave the finger. We're trying to better understand the system, and where those discrepancies lie, so that then we can try to, alternatively figure out legislative ways, fiscal ways that we can be helpful. But we need to do a better job of maybe working together, outside of the council, to try to figure out, because every community is also very different. There are language issues. I really want to figure out this whole older adult, issue where where you have a guardian, a legal guardian, and make that process a little bit more seamless. Individuals with disabilities, that should all be flagged. I
Absolutely, and we agree as well. We are always looking to improve, and as I say to all of my staff at the same time as well, at the end of the day, everyone in this room has the same goal, and that's to serve New Yorkers. And so if there's ways we can work more closely, or there's something we're not seeing in the same way you are, we definitely want to sit down and talk about it and see where we might be able to improve.
Yeah, no, we're problem solvers, and we are very passionate about that, but, we've also been on the receiving end of, food insecurity, and having lived that and knowing what it's like, to not have food that day. And when I go home at night and I have a constituent that is telling me that their benefits were stolen, and now I have to tell them there's nothing I can do, I can't sleep that night, because I know I'm going home and I'm eating, and I can't, I'm thinking, it's horrible, right? I get it. There are a lot of things that prevent us from being able to act a little bit more expeditiously, but it just seems like there's some things that common sense will tell you that, we need to do something today. We can't wait, for anybody to come save us. We have to figure out what the solution is, and wherever we can be helpful on that end, you can see we're pretty much, we're the biggest pain in the butt, so we can. We'll stick Councilmember Caban on them. She likes it. Yeah. All right. So so I want to talk a little bit about the food access and affordability issue. So the cost of food has continued to rise across the country, and many New Yorkers struggle to afford groceries. How is DSS supporting New Yorkers facing this affordability crisis, and what kind of outreach does the city do to ensure that New Yorkers are aware of the services and support that they may be eligible for?
Certainly. So we too are very concerned about the cost of food prices and how they're increasing. We're equally concerned with parts of the House bill that not only would result in potentially $230 billion in cuts to SNAP over 10 years, but also the proposal to do away with the Thrifty Food Plan, which is, a plan that really allows for SNAP benefits to be adjusted, not just for cost of living adjustments, but also when food prices change, when dietary restrictions change, as well as preferences. And all of those are very much at risk right now, which makes us extremely concerned. I will say, when it comes to access to SNAP, though, New York City is really far and ahead of many other places around the country. The USDA has a indicator called the Program Access Indicator, which measures what percentage of individuals at or below 125% of the federal poverty level are accessing SNAP. For 2023, which is the most recent data, New York City's rate was 94.9%, which is the highest we've ever had, and it was well ahead of the states, which was 85%, and the nation overall, which was 80%. So while there's always more we can do, and we're always looking to identify ways in which there are communities we might not be reaching to the best of our abilities, I think it's also important to really highlight what amazing work New York City is doing. That's not just the work of HRA, it's the work of the council, our community partners, and all of those. So those are very much ways in which we, we feel like we are doing well, but we continue to try to amplify, those pieces, definitely utilizing also our partnerships with the 36 NYC benefit partners, who really are within the communities in which they operate is where they serve, and they are best attuned to really identify as well what might be specific outreach activities that would resonate best in that community. And so we rely and partner with them quite a bit as well.
Does rent get factored into a person's, monthly expenses and as a means of determining how much an individual should be receiving? Or what other, because we have people that are working, right, working poor, and they're paying a lot of their income on rent. They may not have enough, to purchase foods, but their income makes it so that they're not necessarily eligible. Do you factor in the rent as a?
We are unfortunately unable to factor in the full amount of the rent. The amount of rent that we are able to calculate as part of the standard of need for cash assistance and SNAP benefits is capped at the shelter allowance amount, which we all know is inadequate.
What is that amount?
So it's, for an individual, it's $215 a month. That is the most of the rent expense that we're actually able to calculate when we are determining SNAP and cash eligibility.
That's horrible. It's almost the same thing like with Section 8 and any subsidized housing. Like, we're asking folks to pay 30% of their income, but instead of asking them to pay 30% of their net income, we're asking them to pay 30% of their gross income, and for some people that means an entire check. That's just horrible. When a person enters a shelter without any source of income, what support does HRA provide to help them access food and other benefits? And where in the process of entering the shelter does that occur?
So the first thing that we do, and we have been doing a lot of work with the shelter providers recently, is to connect people who are eligible for benefits to benefits. And we've been providing shelters with a lot of information about Access HRA and the provider portal, so they can support clients. We're also providing shelters with a lot more information about who in their shelter is in receipt of benefits already and who is not in receipt of benefits, so they know which of their shelter residents to target for benefits applications. And we're going to start looking at which shelters are doing better jobs than others, and those shelters that have higher numbers of people who may be eligible for benefits and not in receipt of them, we can provide additional training for those shelters.
How will you be doing that, and when will you be beginning that process of determining which shelters are doing it and not doing it? Is that like via a survey, or?
No, we're able to connect our information that we have on who is in receipt of cash and SNAP benefits with the shelter information. So we provide that information directly through the CARES system, so they know who is in receipt of benefits and who is not in receipt of benefits.
Yeah, the question I'm asking, a lot of the questions that we ask, are born, from conversations that we have with our own constituents. But in this case, I had a woman that entered shelter. They put her in a temporary site with a kitchen, which is great. She has children. However, she didn't have any money, and she had no income, so she couldn't purchase food. And because she has a kitchen, that means that site is not supplying families with prepared meals. But she also had been there for 2 or 3 days already, and nobody had spoken to her about or asked her if she had access to funding for food. So I had to coach her to go look for whoever the caseworker was on site and make that request. So I'm just trying to figure out, is there supposed to be a process by which when a person comes in and we're asking them a gazillion questions about their personal life and where they live and if they're married and who they're married to, is there a question there that says what type of income do you have right now? And when they say, well, I have no income, does a bell ring and say, okay, well, this is, you can go to HRA and tomorrow and access emergency food assistance, and they'll help you fill out an application, or we can help you fill out an application. What is that? Is that supposed to happen, or is that not like a policy?
Absolutely, shelter providers should absolutely be doing that, and in addition, they should be maintaining an emergency pantry on site to provide food for that day that they arrive if somebody is hungry. And they should have information about nearby community kitchens and food pantries that the families can also access. That is what should happen.
So are all sites, temporary sites, outfitted with a food pantry, or is it just some?
Not every shelter is going to have the space or adequate facilities to maintain an emergency food pantry, but that is the generally expected of family shelters in particular that have kitchens on site, that they do maintain some emergency pantry supplies.
Yeah. So how do we make it so that it is a mandatory part of that conversation, so that we're not waiting until day 2, 3, or 4 to realize that, you know, the family's struggling? Because I get it. In paper, it looks really good. In practice, it's not as nice and rosy as as we paint it. I've been in shelter a couple of times, and it's been a minute. So I'm hoping and assuming that a lot of things have changed. But based on my conversations with a lot of my constituents, it doesn't look like a lot has changed. And it seems like a lot of the staff is very overwhelmed, or not necessarily informed. That they don't have the experience, right, in making these determinations. Or I used to do psychosocials. I worked with older adults that were homebound, and that really helped me because I got to know the entire person. I didn't make any assumptions. I just, I listened, and I had specific questions that I had to ask that were not, too intrusive, but allowed me to gauge where the person was. And a lot of the times, we don't have the resources to employ social workers in these facilities, right? And that's a funding problem. That I get that. But I think that if we give them a set, a list of questions that are like mandatory, you have to ask this, right? You have to, and if this is a yes, then this is what you do, this is where you go next. I think that would be really helpful.
Yeah, and many of those are mandatory as part of completing the independent living plan.
Yeah.
Especially information about income and benefits and all that.
Yeah. I'm trying to figure out how do we do this? How are we proactive in a situation where we don't have much control over who is providing the service and who is interfacing with the client at the moment? So sometimes, we make it a little bit easier by putting these practices in place and ensuring that, that the providers are complying. Okay. Councilmember Russell, did you have any questions? Not this second. Okay. Okay. Could you tell us what the actual spending is? Wait, I don't want to move too far because I think I skipped something. Okay. The American Relief Act of 2025, signed into law on December 21st of 2024, extended the 2018 Farm Bill, which included funding for SNAP through September 30th, 2025. Rhetoric from the current federal administration, especially in relation to cutting government spending, has caused concerns about whether SNAP funding will be maintained after the Farm Bill expiration. If SNAP were to be cut or eliminated, has HRA estimated a potential impact on city residents, and what advocacy is the city undertaking to help protect SNAP benefits for New Yorkers?
Certainly. So, yes, we're extremely concerned about the Farm Bill and potential cuts. As I'd mentioned before, right, we've estimated that there could be up to $230 billion in cuts to SNAP over the next 10 years. We estimated that would result into potentially $870 million in annual funding in SNAP that New York City, and more importantly, New York City residents would lose from their benefits. That would, for a family of 3, result in about $130 less each month, about $1,560 over a year, which are very real dollars. And cuts of that magnitude, right, is not something the city or the state will be able to step in and, fill the gap on that. So we're very concerned. We are doing an immense amount of advocacy at the federal level, around, these, and trying to really highlight the human impact of these types of cuts, that they're not numbers, they're people. And so we encourage and welcome the council's partnership, but we are concerned because, the estimates we've done are, very real and very significant.
Yeah, I mean, it comes
along with a variety of other benefits potentially as well.
Yeah, the administration's really good at poverty shaming and, making people feel like it's their fault that they're, were born into circumstances beyond their control. And also does not factor in that, we have a number of SNAP recipients who actually have jobs and rely on government aid because they still can't make ends meet. So, it really upsets me that we're even having this discussion, because I think when we're on the scale of things, like we're paying for wars that are not even ours, and then we're having a discussion about cutting public dollars for people that live in this country that rely on those benefits to be able to live. It's horrible. It's horrible, and I don't know how the churches don't crumble when they walk in. I digress. Gets me so upset. The Mayor's Office for Food Policy publishes Food Forward NYC 10-year food policy plan in September of 22. The most recent progress report was published in July of 23. One of the plan's long-term goals was the establishment of a food justice fund to allocate funding to community-driven food projects. This was slated to start in 2025. Has there been any progress on this goal, and what is the city's plan going forward?
I'm sorry, what was to be implemented in 2025?
All right. The Food Justice Fund. Establishment of a food justice fund to allocate funding to community-driven food projects.
Yeah, I would have to reach out to the Mayor's Office of Food Policy to understand what that is in reference to.
Okay. And regarding the budget, what is the actual spending thus far in 25? I think I asked that. No, that was for the Food Connection program. This is for overall spending on SNAP benefits, I believe?
I can say in the last fiscal year, the overall spending was about $5 billion.
5 billion? Okay. All right. So with the EBT card fraud issue, does the federal government give any funding for reimbursements for victims of card skimming?
The SNAP benefits were reimbursed through the federal government. Only the federal government has the authority to allow for reimbursement of skimmed SNAP benefits.
Okay.
The cash skimmed benefits are authorized by the state, and those are, we still have the ability through the state to replace skimmed cash assistance benefits.
Okay. Oh, you do?
Absolutely, absolutely. Okay. Unfortunately, it is the SNAP benefits that tend to be skimmed far more frequently than the cash assistance benefits. But it is only the federal government that has stopped the ability for us to replace SNAP benefits. The state still allows us to replace stolen cash assistance benefits.
And I just want to clarify, the $5 billion was calendar year 2024.
Okay. I have 2 questions on Councilmember Hudson's bills. Intro 245, the universal benefits application. What does DSS believe the creation of this application will cost, and how did it come to that determination?
So for 245, the estimate is that the primarily technology that would be required to create an application that can be do universal and then all of the things needed in the back end would be approximately $30 million. Okay. And the estimate is based on similar projects, but
right, it's based on similar costs to add programs and develop the Access HRA common application.
Does DSS believe that there are city benefit programs for which applications can be combined?
I think we would want to do a further sort of assessment, but the primary benefits that people come to us to would not be able to be combined into a universal application such as cash assistance, SNAP, Medicaid. So we would need to look at the other benefits that are both HRA and also provided by other agencies to determine that. Where we can, we have tried to simplify application processes. So for individuals who apply for cash, they also are automatically applying for SNAP and Medicaid because in most instances, if you're eligible for cash, you're eligible for those two benefits as well, and you'll be enrolled. If for some reason you're not eligible for cash, we'll automatically do a separate determination for SNAP and Medicaid separately to determine if individuals, right, are eligible for that. We also utilize SNAP, applications to determine if someone may be potentially eligible for fair fares. And if someone is, that we've determined they meet the income requirements, we will actually fast track those individuals where we will inform them that you are eligible for this benefit. You just need to agree to the terms and conditions and we'll automatically enroll you in that. And we try to do a similar thing with HEAP, which is the state heating benefit for individuals who apply for cash and SNAP. We'll determine if we think they may be eligible for the heating benefit, and if they are, we would auto-enroll them. That's usually, for most people, a one-time benefit of $25 to $50. Those are things we've been able to do within sort of the state and federal requirements we have and working closely with our state and federal oversights to get agreement. We do have concerns about trying to create a much broader universal application, but also happy to sit down and discuss further through that. And
Isn't that what Access NYC does though? I mean, I haven't gone, on
Right.
the site in a while, but isn't the objective of Access NYC that a person puts all of their information and then it determines what a person qualifies for or not?
It determines what you may or may not be eligible for, yes, but then an individual then has to re-enter all of that same information into the actual application for those individual programs. It doesn't automatically transmit or result in an application. It's just a screening tool.
Okay. I mean, I would think that would be a little bit easier and faster, because you're killing a whole bunch of, birds with one stone. How long, the animal rights people do not come at me for that. Sometimes I just say things. The bill also calls for a report on, first question, how long, if assuming that something like this were able to be done, how long do you estimate it would take to create a universal application?
I think I can talk about the assessment piece first and then the technology behind it. But, to do an assessment piece of that, could be a significant piece of time because estimating it will require us to really look at the specific additional regulations or statutes that govern it, and to determine instances where the city could maybe do something on their own, which is going to be few and far between, versus where we're going to need to partner with the state and federal government. So it could be an extensive period of time depending on the benefits themselves. I will say, especially at the federal level, anything that relates to SNAP, the USDA is very they have a lot of parameters around what data can and cannot be used that's submitted for SNAP that could also be utilized for other things.
All right, the report, the bill also calls for a feasibility study that would help us understand if, if it's even possible to create a universal benefits application. Are you supportive of that?
We are open to doing, a feasibility study and discussing with the council. We'd be happy to sit down with the council and the sponsor to talk a little bit more in depth about specific benefit programs and what our initial estimates would be on those and see what potentially came from that in regards to, identifying other steps.
Okay. The bill also codifies Access NYC. Does DSS support that?
Yeah, it's a screening tool, but it is a good screening tool that does provide people with a lot of good, valuable information about the benefits they may be eligible for.
Okay, now 1028, the auto enrollment for city programs. Bill, I understand that the agency is concerned about automatic enrollment as it believes that we should respect the choice of individuals who may not want to enroll in certain programs. Yet many New Yorkers are unaware that they qualify for certain benefits and should access those benefits immediately. And this bill includes an opt-out mechanism. As drafted, how could this bill better meet the needs, meet your concerns about choice?
I think first, as we sort of said about Access NYC, that is a screening tool that does identify for individuals what they may be eligible for. Actual applications for specific benefits are very sort of controlled depending on the benefit, so we don't have a lot of freedom there, as well as we don't really have a lot of flexibility around sort of auto-enrolling people in specific benefits. We're happy to discuss it more, but there are also instances where someone may be potentially eligible for a benefit, but for a variety of reasons we are not aware of, they're not interested in accessing that benefit or applying for that benefit. But we'd be happy to discuss further with the sponsor and the council. But there are very real limitations beyond what I sort of highlighted before in regards to just us being able to automatically enroll people into benefits.
My final question is, what data does DSS not have access to that it would need to determine automatic enrollment? And what agencies do you believe have this information and how could we ensure that you receive it to administer an automatic enrollment program?
That would really depend on the specific benefits that we're looking at. But again, many of our bedrock benefits are very much guided by state and federal regulations in regards to how we receive the information applying for those benefits and what we are or are not able to do with that information outside of the specific benefits someone's being considered for.
Any questions from my colleagues? Yes.
How are you?
Good, how are you?
Good to see you, Administrator French.
You too.
And First Deputy Commissioner Berry. Slightly relatedly, I just was wondering if you had any further updates on the timeline for the work requirements to take effect for public assistance recipients. Do we have any additional
Certainly.
updates?
Yes, so, the rollout will happen in waves. Not everybody's going to start at the same time. The first wave will begin in mid-April, where a group of people will be.
A sense of the scale of that first wave?
I can get back to you on that. They were sort of looking at the numbers of those things, but we are trying to do it intentionally, right? And not overwhelm the system, right, or overwhelm people, right? This is something we're, restarting after several years of not doing it, so we want to be very thoughtful. And it's also a combination of individuals currently on the caseload as well as new individuals coming into the system. So people coming into the system, right, will be automatically put into the process, as well as we're now going to be re-engaging with
How frequent? What is the cadence of these waves?
They will be monthly through right now the end of the year.
So over the course of about 7-8 months, we'll go from 0 to 60. Or we'll cover the full population of public assistance recipients.
The goal is to have engaged almost all of the populations we need to.
And could you just, if you happen to have this on your fingertips, my understanding is that failure to comply with this federal requirement would lead to the city and state losing out on significant federal funds. Can you speak to the scale of the funding that we would lose if we did not comply with the work requirements?
I can't speak specifically to the scale just because we haven't experienced this before, and this is not something the federal government has really been implementing, that much, so there isn't a lot for us to specifically look at. But what I can say is it is a requirement. The requirement is actually connected to the work participation rate the state is meant to get for individuals on TANF, right? That's almost exclusively families with children, and those rates are set at the federal level, and that missing those rates will incur, fiscal penalties. My understanding is that, the penalties could be on a sliding scale depending on how close or far you are from the rate you were supposed to meet, but, the details of that we don't fully have, but we expect it to be, potentially in the tens of millions of dollars or more, but we don't have specifics on that, but it's significant.
And your current modeling is that you're anticipating 40,000 additional public assistance recipients will take advantage, will need, I should say, childcare vouchers to be able to manage the work requirements. That's right?
That will need and will be eligible, right? There's a couple of things going on. I will say pre-COVID, we averaged about 41,000 in cash assistance clients accessing childcare. So that was sort of the pre-COVID baseline. Currently, we're at about 23,000, and we do expect for that to increase to about 63,000 between now and January of 2027, where we think it would stabilize. So, that is it. The increase we expect is due to a couple of things. A, the caseload of cash assistance is much larger than it was in 2019. And there was also a change in child care certification periods. So individuals are certified for 12 months, and they can remain on have that child care for 12 months, even if at some point an individual dropped off the caseload, say for non-compliance. So there's a couple of things going on in our model that result in the increase in need we see.
And just for our benefit, as these state budget negotiations are unfolding in real time, are you able to share with us updates on a monthly basis on people that are taking advantage of child care vouchers, mandated vouchers? Is there an interval of updates that can be shared with the council so that if your modeling was more or less, higher or lower than anticipated, that we can adjust accordingly and think creatively? As I imagine this is going to be depending on how they navigate this in Albany, this will be an important conversation for the city budget as well.
Absolutely, we can look at what would be the right interval to update on utilization as it relates to childcare. We will be tracking it very closely to see if our trends analysis and sort of model is on the mark, under the mark, above the mark, so that can.
You think we could anticipate like April and May and June updates to inform budgetary decisions? Is that I don't mean to put you exactly on the spot for the interval of the updates or whatever, but do you think we will be getting data updates from you this spring that can inform budget decisions?
I think that we anticipate seeing significant start of shifts in this probably in June. As we sort of start, the way in which the system works out, also because people have time to determine if they need or access childcare through the application process. So, someone who applies, say, in April, and has a mandatory requirement, has that 30 days, and potentially we could give them more time if they say they need childcare but have not been able to find it yet. So we need a couple of months to actually have the system in place.
So just to realistically set expectations, you don't think we're going to have much data that's going to tell us much by June?
I don't think that would be able to inform budgetary negotiations. I don't.
That's helpful to understand. Thank you for the chance to raise a slightly germane but not exactly on topic question. Thank you for the
I was
answers.
ready, so.
He just had a baby, so he's very dedicated. I don't have any further questions. I just want to, add that, I'm really serious in terms of, partnering with DSS to try, this is a very difficult year, and with all of the threats that are coming from the federal government that will trickle down to our state budget, that will then trickle down to the city budget, we need to be as aggressive as we can. And so please, utilize us. You write letter writing campaigns, calls. We want to go and sleep in front of, the White House, whatever you want to do, we're there. But I think that if there's a time to really show a united front, that this is the time. We cannot afford to lose a single cent here in New York City. Too many people rely, on those services, and they rely on us to make sure that they have them readily available. So thank you so much for being here today, and I look forward to hearing more during the executive budget cycle. And definitely please ask for whatever it is that you need, realistically.
Thank you.
Thank you very much.
Appreciate it.
Thank you. We're going to take a 5-minute break so that I can go downstairs and use the restroom, and then we're going to start with the panel discussions.
Anyway, thanks for your testimony. Thanks for everything you guys had to say at a meeting with Jamar Hooks. We'd love to talk more. Really appreciate it. Appreciate everything you're doing. Yeah, nice to meet you too. Tell me your name again.
Jill Berry.
All right, I'm Jonah Birch. Nice to meet you.
We do want to do as much
No,
as
totally. I know. I get it. By the way, you know, given the federal situation, like I know.
There's another hearing next door, so if we could keep the voices down, thank you.
We would love to talk. Thanks. Yeah. go past this, okay?
Okay, we're back. I now open the hearing for public testimony. I remind members of the public that this is a government proceeding and that the quorum shall be observed at all times. As such, members of the public shall remain silent at all times. The witness table is reserved for people who wish to testify. No video recording or photography is allowed from the witness table. Further, members of the public may not present audio or video recordings as testimony, but may submit transcripts of such recordings to the Sergeant of Arms for inclusion in the hearing record. If you wish to speak at today's hearing, please fill out an appearance card with the Sergeant at Arms and wait to be recognized. When recognized, you have 2 minutes to speak on today's hearing topic: hunger and food insecurity in New York City, or any of the 3 bills that we are hearing on today. If you have a written statement or additional written testimony that you wish to submit for the record, please provide a copy of that testimony to the Sergeant at Arms. You may also email written testimony to testimony@council.nyc.gov within 72 hours of this hearing. Audio and video recordings will not be accepted. We will now call the first panel. Lynette Brown, Lakeisha Morris, Molly Eckerl, and Joseph Rosenberg. Hello. Either one of you at each end, you want to begin? Okay. Just make sure that the mic is on.
Is it on now? Okay, perfect. Good afternoon, Chair Ayala and fellow committee members. Thank you for holding this hearing today. My name is Molly Eckerly. I'm the Food Policy Associate at the Metropolitan Council on Jewish Poverty. I'm here today on behalf of Met Council's food programs. We operate the largest kosher food pantry network in the country, providing kosher and halal observant food assistance to 200,000 New Yorkers annually, regardless of religious observance. It's on behalf of those we serve and all New Yorkers that we and our partners Catholic Charities and Hispanic Federation urgently request that City Council allocate $20 million in discretionary funding for emergency funding for food pantries. During the pandemic, at the height of need and uncertainty, New York City wisely created a special fund for emergency food, allowing us to deploy needed resources to areas with limited pantry and social service infrastructure, to communities with religiously informed or culturally nuanced diets, which are often left out of the emergency food system, and to programs that facilitated increased access to emergency food. Due to the success of this initiative, we're urging City Council to commit $20 million to continue and expand the important work that has been done. Additionally, we want to express our support for the Council's decision to call on the administration to baseline fund Community Food Connection at $100 million and reiterate the importance of this program. New Yorkers observing religiously informed diets will go without food if the emergency food system does not provide appropriate products. CFC provides flexible funding that allows Met Council to purchase the products that clients want and need. Because of this incredible flexibility, City Council must continue to invest in programs like CFC that meet the needs of all hungry New Yorkers. The decisions made by this committee will impact the lives of millions of our neighbors. Allocating $20 million in discretionary funding for food pantries and funding CFC at a baseline of $100 million, this committee can benefit all food insecure New Yorkers, including those with religiously informed dietary restrictions. We thank you for your time today, and we hope to continue to work with this committee and City Council to fight food insecurity.
Good afternoon, Chair Ayala. I'm Joe Rosenberg, the Executive Director of the Catholic Community Relations Council. Thank you for holding this hearing. Its focus could not be more timely, and thank you for being such a tremendous supporter of all of our food pantries. Catholic Charities of the Archdiocese of New York and Catholic Charities of Brooklyn and Queens have been providing shelter, food, and clothing to New Yorkers for more than a century. These two charities combined, along with parishes in both dioceses, operate over 80 food pantries throughout the 5 boroughs and serve more than 80 million meals annually. Both organizations, as well as other nonprofit human service providers, have faced many challenges feeding hungry New Yorkers over the years. Right now, this challenge is at a crisis level due to several factors. These include the increasing poverty rate of New Yorkers, the dramatic increase in rents, including the rising percentage of households who are rent burdened and paying over 50% of their income on rent, and even more significantly, the uncertain status of federal programs such as SNAP and the Emergency Food and Shelter Program that provide essential funding to address food insecurity for vulnerable Americans. Nonprofit providers have seen the number of clients at pantries increase significantly. We are not just assisting more working families, seniors, and children at our pantries. Newer clients include college students, recent college graduates who are either unemployed or underemployed, youth aging out of foster care, and new migrants, many of them with infants. The plight of hungry children is particularly heartbreaking, with more than 1 in 4 in our city living in poverty. That is why, with more New Yorkers going hungry, we urge that $20 million in emergency food for pantries be included in the FY26 New York City budget for both Catholic Charities as well as our partners, Met Council and the Hispanic Federation. Spurred on by rapid food inflation, clients as well as the pantry serving them have been negatively impacted financially. As a result, we have difficulty providing as much fresh food to clients as in previous years due to these costs. With more New Yorkers relying on pantries, we are forced to distribute dry goods and canned and jarred products rather than fresh produce to ensure that our clients do not leave hungry. Our mission is to serve needy New Yorkers and help stem their hunger while providing them with the healthiest food options possible. Our city faces daunting challenges, but few would disagree that our most important priority would be to ensure that New Yorkers do not go hungry. We therefore call for your support in including this essential $20 million in the city budget. Thank you.
Good afternoon, Chair Ayala. My name is Lakeisha Morris, and I'm the Division Director for Food and Housing Stability at Catholic Charities Community Services. Catholic Charities is committed to serving vulnerable populations, providing assistance to those in need across the Bronx, Manhattan, and Staten Island. Just last year, we served over 5.8 million meals to over 58,000 unique households of a total of 650,000 individuals. Rising demand and challenges that we're seeing today is about 25% increase in the number of people that are food insecure coming to our pantries. And that's due to the lack of SNAP benefits, food inflation costs, and lack of income. As donations decrease and food costs rise, it's especially essential needs like eggs, meat, fresh produce that many of our community members need. The demand has grown, but the resources is dwindling at this point. Funding shortages with the federal and city level, and it's really crippling our ability to make sure that every household that is in need of food is able to access it. What we're asking for is to consider funding $20 million in the city funding to allow us to be able to do the vital work that needs to be done to serve our community members so no one goes hungry. In addition to that, we're asking that we restore and increase CFC funding, make it stable so we don't have to sit here every year wondering how we're going to feed our New Yorkers in need. And in addition to that, we would really appreciate your support in our state ask as it relates to SNAP and food assistance funding, like FSAP, for instance, that is on hold today, that has crippled many of our pantries. And I thank you for your time.
Good afternoon, Chair Ayala and fellow committee chair members. I am Lynette Brown, Food Resource Coordinator for Catholic Charities, Brooklyn and Queens. I have worked within our network of 61 food pantries throughout Brooklyn and Queens since 2023. Before that, I was a volunteer at our network pantries, St. Benedict the Moor in Jamaica and Our Lady of Mercy in Brownsville. I'm happy to be here today as the subject of food and hunger insecurity in New York City is close to my heart. Since the pandemic, many of our pantries have seen an increase in attendance of 1,000% or more. Small parish pantries that fed 25 to 30 people each week started seeing 400 to 500 clients. Things started to level off in 2021, and while we never went back to pre-pandemic numbers, things became more manageable. By 2023, our network of 61 pantries was feeding an average of 25,000 people a month. But we have seen a steady increase in the number of people needing food, and it is a diverse population that spans from young adults to elderly, working families, college students, and the underemployed. Our pantries in southern Brooklyn, especially Our Lady of Miracles in Canarsie, have seen an influx of newly arrived Haitians and Ukrainians. We are seeing more and more young people come to us for help. Last year, we opened a pantry at Our Lady of Sorrows in Corona. Many of the clients, they have families with young children or they're helping support their parents. Our pantries in Long Island City and Woodside, Queens are seeing a larger number of people than ever before. Since the fall of 2024, we are feeding a total average of 37,000 people a month throughout all of our food pantries in Brooklyn and Queens. The price of food is rising, and funding is becoming more difficult. As hard as last year was, this year is proving even more difficult. The uncertainty of what lies ahead for the federal government has everyone nervous. The price of staples such as eggs, butter, milk, fresh fruit, and vegetables has surged. These increases have forced us to change our food distribution. Please support our continuing efforts to feed hungry New Yorkers by providing $20 million in emergency food pantry monies in the fiscal year 2026 New York City budget. Thank you.
Thank you. I was going to ask a question, Lynette, about the increase, but you spoke very eloquently about that.
Yes.
But my question, Joel, I think is the around the $20 million ask. Is that consistent with the funds that we were able to get allocated throughout like the pandemic when we saw the need for more resources at our local pantries grow?
I'm sorry, could you repeat that?
So the $20 million,
Yes.
is that comparable with funding, with the funding that was provided during the pandemic, the onset of the pandemic, the additional additional funding that was given to food pantries to make up the difference for the increase in population?
It's helpful. I mean, I think the 20 million was basically chosen because we're all suffering such need. It wasn't particularly quantified, but you were obviously indispensable in helping to provide the 1 million, which each of us has 250,000 with from last fiscal year. But things have deteriorated, prices have increased. References were made to the emergency food and shelter program. Both Catholic Charities have sustained loss of $800,000 each in this program. And that doesn't even include the $230 billion that Congress appears to be poised to reduce in SNAP. So the 20 million will be absolutely indispensable. Will it offset what is coming in our direction from the feds? Unlikely, but it will prevent people from going hungry.
I appreciate it, and I appreciate all of you and the work that you do each and every day, and we will continue to support those efforts as well. Thank you so much for your testimony today.
Thank you.
Our next panel is Eric Lee, Rachel Sabella, Lo Anderson, and Shirley De Peña. Whoever wants to begin first on either end, you want to begin first? Yes, okay. Just make sure that the light is red.
I submitted written testimony, so I'm just going to give highlights, briefer highlights. Good afternoon, Chairperson Ayala and members of the General Welfare Committee. My name is Shirley De Peña, and I serve as a director in the Central Office of Student Affairs and the liaison to the campus resource centers and food pantries at CUNY. Thank you for the opportunity to testify. I begin by expressing my sincere gratitude for your support of CUNY's food security initiatives. Food insecurity is one of the most urgent challenges facing CUNY students today. When students struggle to afford food, they often face increased stress, difficulty concentrating in class, and a greater likelihood of dropping out. Many of our students are already balancing coursework with jobs, family responsibilities, and financial hardships. CUNY has food pantries operating at 18 undergraduate colleges and 2 professional schools. Our students can visit any food pantry regardless of their campus of attendance. These food pantries do more than just provide groceries. Many pantries are located within campus resource centers where staff assist students in applying for SNAP, emergency financial aid, and connecting with other critical services such as housing assistance and mental health counseling. The need for these services has grown at an alarming rate. In 2024 alone, CUNY food pantries recorded more than 206,000 visits, an extraordinary increase from 58,941 visits in 2022 and 146,544 visits in 2023. Beyond food pantries, City Council funding has allowed CUNY to implement the Fresh Food Bag Program, providing students with fresh produce, bread, eggs, and culturally appropriate food options, helping to alleviate hunger while also creating opportunities for students to connect with vital support services on campus. Despite the success of these initiatives, demand continues to outpace available resources. CUNY students are hardworking, resilient, and deeply committed to their education, but no student should have to choose between paying for textbooks and putting food on the table. If we want our students to succeed, we must ensure they have access to the fundamental resources they need to thrive. I urge the Council to continue and expand its investment in food security programs at the cost of $1.125 million at CUNY. With additional resources, we can sustain and grow our food pantry operations, expand the Fresh Food Bag Program, and enhance the critical support services that help students. Thank you for your time.
Hi, good afternoon. Thank you, Deputy Speaker Ayala and members of the committee and central staff for being here today and allowing me the opportunity to testify. I am Eric Lee, Director of Public Policy for Volunteers of America, Greater New York, a 129-year-old anti-poverty organization which seeks to end homelessness in the Greater New York area through housing, health, and wealth-building services. I submitted written testimony, which I will summarize given the time. Thank you, Deputy Speaker Ayala and members of the committee for your steadfast commitment to protecting the human services safety net. Hunger and food insecurity for low-income households is already far too common, and unfortunately, it's only going to get worse. With regards to federal cuts, we urge the Council to use your voice to call on Congress to maintain and increase funding for SNAP, as Commissioner Park estimates that 1.8 million New Yorkers rely on this critical lifeline and could cost the city up to $900 million per year if Congress does not back away from proposed cuts. We also urge the Council to call on Congress to restore funding to the Emergency Food and Shelter Program, or FSAP, which was testified by others today. VOA GNY utilizes this funding to feed survivors of domestic violence within our 7 DV programs, and FEMA halted $3.9 million in congressionally approved funding to us and 96 other FSAP recipients in New York City beginning on January 27th. Given these federal cuts, we urge the Council and administration to double down on local resources to keep New Yorkers fed. VOA GNY greatly appreciates the Brooklyn delegation's current support for our food pantries program, which is utilized to create food pantries within our SRO supportive housing sites, as well as offer culturally appropriate meals and fresh food options within our shelters in Brooklyn. We ask the council to please consider our FY26 request of $20,000 per borough to the Bronx delegation, Brooklyn delegation, and Manhattan delegation to further expand this critically needed program. Do you mind if I offer comments about legislation? Okay, thank you. With regards to the legislation being considered today, for Intro 245, we're supportive of DSS exploring the feasibility of creating a universal benefits application. But one flag we have is it's not clear to us how city benefits are defined based on Section 21-151 of the code. For Intro 1028, we're supportive of streamlining public benefits, but recommend that enrollment must have an opt-in requirement rather than an opt-out. For each household in the for each adult in the household, to make sure that they wish to receive benefits and avoid inadvertently harming their personal situation. Examples where this could be problematic include survivors of domestic violence who are fleeing their abuser, young people who are seeking emancipation from the parent or legal guardians, as both of those cases, if they're already added to a household and are trying to apply for their own benefits, would be denied. And we also are concerned about immigrant households who would be seeking permanent residency status given the public charge concerns around that. Finally, for Intro 148, we strongly endorse this legislation to require DSS to provide receipts for applications for benefits and services. We recommend the receipt also be automatically uploaded to the applicant's Access HRA account so that they can download it on demand should they lose their paper copy. And the receipt should also include the name and email address of the DSS caseworker to allow for timely follow-up by the client or provider, as well as foster additional transparency and accountability within the process. Thank you for the opportunity to testify today.
Sorry. Good afternoon. My name is Rachel Sabella, and I have the honor and privilege of serving as the director of No Kid Hungry New York. Chair, I want to thank you for your steadfast work on this. What we heard today was how important this is, how you're holding the administration accountable. We are lucky to have you leading in this battle, and I am proud to call you one of my hunger heroes. So thank you. I also want to thank the full council body and the staff. This council has always come together to fight for what is right and to put food on the table. Last year, when the administration cut school meal programs in the middle of the year, it was this body that got it restored in a month. It was this body that worked with us to get information out to families on summer EBT this year. And I so admire the work the council is doing for immigrant families right now. This is more needed than ever before. I have worked on anti-hunger programs for more than 10 years. I have never seen anything quite like what we're facing right now. We just did a survey of New Yorkers, and what we found is half of New Yorkers are going into debt to pay for groceries. 86% have said their incomes are not rising as fast as grocery prices. New Yorkers also told us that not only is this stretching their checkbooks, but it's affecting their mental and physical health. They're cutting meals, they're skipping meals, they're hiding food to make sure there are resources for children at the end of the month. And we know what our survey tells us, what our experience tells us, is these numbers are much higher in communities of color. But what does give me a little bit of hope is that New Yorkers don't support these cuts. They also believe that solving child hunger should be a bipartisan solution. This is not a time to play games. So you have my written testimony with all the data and policy recommendations and things, but I just want to sum up my ask in two ways. One is we want this entire body to work together, again, in a bipartisan way as we advocate in Washington. It's not about politics, it's about what's right. It's really scary what these SNAP cuts could be, the proposals, whether limiting choice, cutting benefits, pushing costs onto states. It could have a devastating effect. There are also potential rollbacks to school meal programs. That's something we want to keep in mind when New York City is giving free meals to every child and when the state has a major proposal there too. My second ask, and I will be very quick, and I think the word proactive was said by every council member today. How are we making sure the administration is being proactive? I think about school meal programs. There is so much growth for participants participation in school breakfast that doesn't have a financial implication? What is the administration doing? Is SNAP outreach happening in school buildings and after-school programs, that TA to help people get their summer EBT benefits? Are people getting information about where pantries are? We know they can't fix the SNAP skimming, but there are other things that we can do. We also know New Yorkers are afraid, and they have trusted sources that they can go to for support, and we want to make sure the administration continues to support them. So I thank you for everything you and the entire team are doing. Please count us in this work, and we are here together to make sure No Kid Hungry is a reality.
Good afternoon. Thank you so much for the opportunity to testify this afternoon. My name is Lo Anderson. I'm the Student Engagement Coordinator for a program called CUNY Cares. It's a pilot program right now that is a combination of the CUNY Office of Transformation and the Graduate School of Public Health. And so we hope by FY26 to prove to the CUNY Chancellor that this is a program that is worthy to spread to the other CUNY campuses. So what do we do as CUNY Cares student navigators? We meet the student with peer-to-peer support by helping them, and I call public assistance litigation, everyday litigation, right? So do you respect and qualify college students as the everyday litigators that they are? 18,000 folks across the 3 Bronx campuses that we serve. So Hostos Community College, from which I am a graduate, Bronx Community College, and Lehman College together. They have already been leading the way in terms of food security through their Access Resource Center, which you heard my colleague highlight. So we have our local superheroes of Madeline Cruz, Dawn Daniels, Rain Diaz, Baraka Corley, who lead the conversation on food insecurity every single day on campus and help students who are coming to campus hungry, because there's no way that we can continue to advocate for higher education, folks actually learning in the classroom while they're hungry and worrying about losing their housing and furthermore benefits in the midst of that. So it was interesting to be in this hearing and participate. I do want to thank you for the accountability of all 3 of these legislations that are providing some sense of accountability towards DSS, because I can tell you from the direct service level, there hasn't been a lot of it for us. Fair Fare specifically, I can say, while expanded eligibility has been introduced, I can tell you that a student who works 40 hours at McDonald's does not qualify for the Fair Fares program currently. I can tell you that students that I advocate for on the ground every day in order to access or process a one-shot deal for housing, arrears, or anything that they deal with is upwards of 6 applications in order to process it correctly. 30 to 45 days is the full day that is set by DSS in terms of determination, and we find that it is egregiously more than that. So imagine a student dealing with a 1 semester. 30 to 45 days is simply insufficient. So we appreciate your support, and we're asking for $300,000 to expand upon the work of these resource centers and move CUNY Cares to all City University of New York campuses. Thank you.
Thank you so much. Do you know how you're asking for 300 more or 300?
I believe that's in addition. I know that we have asked from the Bronx delegation as well. So, and we are advocating at the state level for $4 million to expand the program.
Okay. All right, perfect. Mr. Lee, I had a question for you. The food pantry programs within the shelter system, are those funded through the city, or are those funded through the nonprofit organizations that are running the shelter?
So we receive funding through our DHS contracts for food for our shelters where people do not cook themselves. But at the same time, we also layer on the funding from the Brooklyn Borough delegation to enhance it, because unfortunately the DHS contracts do not pay a very high amount for the food, and we want to be able to offer culturally appropriate, rich, nutritious, fresh foods to our people within our facilities.
So in the case of an individual like the one that I referenced that was in shelter for several days, didn't have any income, did not have a SNAP case open, she's in a shelter where she can cook if she had the food. Does in situations like that, in shelters that are run by your organization, are those folks automatically screened for food insecurity, or to ensure that
our caseworkers work with our clients to get them on public benefits. If they cook themselves, or if they have facilities that can cook in there, for at least in Brooklyn, we have the ability to then have those food pantries to offer food if their food stamps run out, if they're a little short. We have that extra cushion there based upon the council's support. We would love to be able to offer it within also Manhattan and the Bronx, which is why we expanded our ask this year to those 2 borough delegations as well.
So the city only provides funding for shelters where there is no cooking facility, no cooking available, right?
Yeah, for shelter facilities that where clients do not have kitchens within their units, they would offer food to prepared meals for the clients.
Okay, and in the cases where the person can cook, those pantries, if there is one, are funded through the council funding?
For our sites, not
Your sites, but you're not receiving any other funding to run those.
So for DHS facilities where people cook themselves, not every building would have pantries. That's based on a building by building, contract by contract thing, and that's how we try to creatively use funding within VOA. But that's not something that I can't speak to every provider, but that's how we do the food services within our buildings.
And how soon does the caseworker that's interfacing with the client do the assessment, makes the assessment on whether or not that individual may or may not need emergency food?
I can get back to you on that information. The other thing is to speak more broadly to how VOA works is like the FSAP program. We use that to enhance our food options within our DV program. So trying to creatively look at how we can enhance the services and options and to ensure that holistically the people within our buildings have the food that they need, connections to care, services, and other things. And that is one way in which, as I mentioned in my testimony, we are concerned that with the freezing of those funds from Congress, that we would welcome the council support in calling on Congress to push FEMA to release that, because that is not within FEMA's authority currently.
Perfect, thank you. Did you want to add something?
I just wanted to add in with respect to the DHS process, there are places and units, we have a lot of students living in shelter, period. So that's the reality, and we do have programs that are coming out to combat that, but in the interim, I do hear constantly from my students who are living in shelter that their access to food as they live in shelter is decreasing. One example I can give you is a young mother of twin daughters who were staying in a hotel in Queens and had staff from the shelter come and remove the only microwave that she had. So for someone with twins under the age of 3, to me, egregious, with no previous memo, with no notice and no reasoning why. So I would certainly pay attention, through the ombudsman to see what folks are complaining about food security specifically, because I know in the Bronx for certain, I hear those complaints a lot as well from students and their families.
No, that's very helpful. That's very helpful. All right. Thank you guys so much for the work that you do and for coming here and spending the day with us to really lend, truth to this crisis that we are facing. And hopefully, if you have any creative ways that you think that we can be helpful as well, you know where to find me. Thank you. Our next panel is Nick Buis, Deborah Berkman, Naima Dahir, and Kim Mascaritolo. All right, you can begin.
Good afternoon. Should I start? Okay. Deputy Speaker Ayala, staff, thank you so much for the opportunity to speak today. My name is Deborah Berkman, and I'm the director of the Shelter and Economic Stability Project at New York Legal Assistance Group, or NYLAG. My specific project at NYLAG helps people access and maintain public benefits, and I'm intimately familiar with the subjects of today's hearing. First, I would like to speak out in support of intro number 1148. We very much support requiring DSS to provide a receipt for all applications for benefits or services, and particularly a detailed receipt for the documents submitted. So many times NYLAG clients visit DSS offices and attempt to apply or recertify or otherwise change their public benefits, and they come away empty-handed. Clients are later told that documents are needed when they were already submitted, or that clients' applications are denied for failure to submit documents when in fact they did include those documents with their application or submitted them within the time frame required. Given the current disorganization of DSS and how many applications or recertifications are simply not acted upon, it's imperative that receipts are given so that clients may follow up on their applications. Second, NILAG has some concerns about intro number 1028. While we applaud the intent of automatic enrollment of eligible people in city-created benefit programs, we are concerned about the collateral consequences of involuntary enrollment. While the bill does contemplate an opt-out provision, it's very likely that many people will never know that they've been enrolled in public benefits or how to opt out. And in the current political climate, people have very valid reasons why they may not want to access certain public benefits that they're eligible for. Moreover, the bill is silent on people who don't meet the requirements for the benefits that they're accidentally enrolled in and what type of repayment for benefits wrongly issued would be mandated. That's why NILAG thinks that all benefits should require an opt-in, not an opt-out. But in keeping with the spirit of the bill, NILAG does support an automatic screening with a simplified opt-in mechanism so people are able to more easily access those benefit programs. Just very quickly, far too many of our neighbors are going hungry, and I think that a huge part of it is that people are not able to access their food-related public benefits, specifically SNAP. My team assists numerous clients every day who are hungry and reliant on SNAP, but because of DSS's failure to process their applications properly or their recertifications, they have their SNAP benefits denied or discontinued. And while, of course, we're able to get their benefits restored retroactively, as we all know, people need to eat on a consistent basis, and they can't eat retroactively. And most of these clients that we have are elderly or they live with disability, and when their SNAP is discontinued, they just don't know where to turn. I wanted to answer a question that the Deputy Speaker had earlier today also about how to help someone who's about $5 below the SNAP eligibility requirement access SNAP. So there are a lot of, while the federal rules can change and the city doesn't have any access to change those rules, what they can do is help people engage in SNAP budgeting that would make them eligible for more benefits. And so for elderly and disabled people, that's computing their medical costs, and that would change how much SNAP that they would be eligible for. And for everyone, there's something called SUA. And if people pay for heat and electricity and/or electricity, they get a bigger sort of income deduction, which raises the amount of the benefit that they would get. And that's really important, and it's something that HRA can do. They can screen for these issues instead of just relying on clients to know about these things. Even most professionals who work in this field don't know about these things. So there are steps that HRA can take within the federal guidelines. Thank you very much for the important work you're doing.
Good afternoon, Chair Ayala and members of the Committee on General Welfare. My name is Naima Dahir, and I'm here with the Arab American Family Support Center. The Arab American Family Support Center provides culturally and linguistically competent, trauma-informed, multi-generational social services to the growing Arab, Middle Eastern, North African, Muslim, and South Asian communities. At AAFSC, we ensure that immigrants and communities of color receive support and services in culturally competent settings where our teams understand their background and speak their languages, removing one of the biggest barriers to care. We provide wraparound services including domestic violence, case management, housing navigation, legal services, and food distribution, ensuring that community members receive holistic support. Our community's health and well-being team assists thousands of clients annually in enrolling in public benefits such as SNAP, cash assistance, one-time emergency grants, heating and energy benefits, and health insurance. And New York City cares for individuals who do not qualify through New York State programs. We conduct proactive outreach, including pre-screening events and application assistance to ensure clients access the resources and supports they need to apply. Our clients face numerous bureaucratic barriers when applying for public benefits. Clients struggle to track their application status, often receive unclear instructions about documents. They are not provided receipts confirming their submission, making it difficult to track progress. Many face obstacles such as long wait times, ranging from hours on the phones to entire days in person. language barriers, and the need to reapply multiple times due to incomplete or lost paperwork. At HRA offices, our clients endure long lines and language barriers due to limited language access. Clients attempting to schedule interviews or follow up on their applications face further roadblocks, and at times they are unable to get proper assistance to schedule interviews. They run out of time to complete their application process. I will quickly summarize the rest so I can get through this. Under this current challenging backdrop, recent federal administration policies that also place our communities in immediate jeopardy. These policies disproportionately impact our Muslim, Arab, Black, South Asian communities that we serve. And we're noticing that our communities are relying on us as trusted organizations even more right now, more than ever. At this moment, we are enhancing our outreach to ensure that our clients apply, despite fear and other barriers. These inefficiencies of the system take away valuable time away from our organizations who are already stretched thin. Funding freezes and delays are creating unprecedented uncertainty. Our organization faces $1.1 million shortfall amidst growing need. So we really urge the City Council to help alleviate these challenges. We support the introduction of these bills, and thank you so much for allowing me to testify today.
Hello, I'm Kim Oscaritolo. I am the Director of Communications and Advocacy for Hunger Free America. Our overall message is very simple. New Yorkers still face massive food insecurity and hunger crises citywide, and we need a massive response from the city, especially one that focuses on increasing participation in federally funded SNAP, WIC, school breakfast, and the new summer EBT program. And given the massive funding cuts that are proposed, and in some cases already implemented by the federal government, it's more important than ever for New York City to step up and ensure that all New Yorkers have access to nutritious food. We are here today specifically to support Intro 245, which would mandate the report on the feasibility of creating universal benefits application and mandate the creation of such a universal benefits application as determined feasible by the Commissioner of DSS. So while it is true that it is easier to apply for multiple benefits in New York City than in much of the rest of the state, it is still an onerous process to obtain those benefits. Rather than being able to apply for multiple benefits at one time, low-income New Yorkers are forced to spend countless hours traveling to and waiting at social services offices, spending long times on phone calls, taking time away from work, or raising their children. Economists often talk about the term opportunity cost as it relates to higher and middle income people, meaning time they spend on one task is not available to perform another important task, but they rarely apply this concept to low income people, acting as though their time is essentially worthless. But the reality is applying for benefits in New York City is a time-consuming, humiliating, and costly process. So we have long championed the idea of a single portal, including the My City portal, which we have been very supportive of. We were particularly disturbed by reports that the city has already spent $100 million on My City, and none of the most important features are operational. So we are not technology experts, but every day our dedicated benefits access team works with struggling families to help them apply for and receive benefits they desperately need, and we see the difficulties they face. So once again, we fully support Intro 245, and we hope that you will work expeditiously to get this work started. Thank you for the opportunity to submit this testimony.
Hi, good afternoon. I'm Nick Buse from the Food Bank for New York City. Thank you, Chair, for your continued commitment to addressing food insecurity in New York. Thank you to the Council for continuing to stand up for specifically food pantries and soup kitchens across our city. We want to recognize, acknowledge, and thank the Council for including $100 million of baseline food funding for the Community Food Connection Program. You saw it this morning on the steps. Food pantries and soup kitchens are worried. We're worried because we stand in the gap. That's what Councilmember Banks was asking. Who stands in the gap when SNAP's not available? Food pantries stand in the gap. It's the last best option for our community members. You know this. But we need to make sure that our community-based food programs have the support, have the capacity support, and have the food support available, particularly in the face of what's happening in the federal government. We can't retroactively eat. So even if things are moving around, even if we are successful in receiving more food from the USDA, today we have 2 million meals that are suspended from the USDA. we have to fortify our network so that we can make sure that food pantries have the supply they need. So I have a little bit more details in the written testimony, but I just want to say, close by saying that the City Council's Food Pantry Initiative and emergency funding for food programs is an essential part of our need in the next year as well, given these uncertainties. Thank you.
Thank you all for your testimony, and thank you for that information. I had no idea. Yeah, please. Yes, thank you so much. Our next panel, Stephen Grimaldi, Molly Eckert, Jeanette Estema, and Anita Kwok. Jenny Veloz. Hello. You may be.
Okay. Good afternoon. Thank you, committee. Thank you, committee chair Ayala and members of the Committee on General Welfare for this opportunity. I'm gifting you, Diana, 300 plates from our participants in multiple languages: French, Spanish, Mandarin, and English. Notes from our participants who are concerned about the cuts to the Community Food Connections program. As you know, hunger in New York's reached epidemic proportions. I could go through the data. 1.3 million households, nearly 3 million people are struggling to make ends meet, according to the True Cost of Living report. 1 in 3 New Yorkers used a food pantry in the past 3 years, of course, according to Robin Hood. The data goes on and on and on. I think we have, you've heard already today, more information about that. I know you're aware of that. Last year, we served 11 million meals at the New York Common Pantry, and we're on pace to serve 12 million this year, assisting 730,000 visitors. When I started, we were serving 1.5 million meals to roughly 100,000 guests. We continue to do more. Last month, we experienced a 13% increase in March compared to last March. So just comparing that particular month. And of course, that's an increase. That's on top of the increase of 17% in individuals we served last year. A lot of people have talked about the cuts. Recent Department of Agriculture termination of the Local Food Purchase Assistance Cooperative Agreement. This funds NIF, or New York Food for New York Families. Last year, that was $1.9 million for the New York Common Pantry. That's a gap of over 2.3 million meals. Never mind the SNAP cuts that are coming, WIC, possibly CSFP, EFSP, which we already know about, TFAP, which Nick just talked about. A lot of these cuts are going to layer and really hurt those we serve. We applaud the city council for the baseline funding for $100 million per year, and we hope that the budget will include that. My last thing, I did want to say a little bit off script, listening to First Deputy Commissioner talk about mobile pantries. We have 60 mobile sites in addition to Nourish sites. We have about 175 sites mobilely across our city. We have been waiting for 2 years to get an EFRO number from the city so we can open more mobile pantries and we can get CFC money for that. So yes, we need CFC money to be able to do that, but we also need to have clearance, just a site visit, which we have been promised for 2 years. There was an initial visit. So those are the sort of things that can easily be done. Once we get an EFRO number, we can start distributing CFC food. Right now, we can only serve CFC food to our brick and mortar locations.
I can try to make a connection there so that
Okay,
we can,
thank you.
Thank you, Chair Ayala, for convening today's oversight hearing. My name is Anita Kwok, a policy analyst for United Neighborhood Houses, a policy and social change organization representing neighborhood settlement houses that reach over 800,000 New Yorkers from all walks of life. Food insecurity emerged as a top community need at settlement houses in the beginning of the pandemic, and today demand for food assistance remains higher than ever. Settlement houses address hunger through benefit enrollment, pantry services, community outreach, and referrals. Still, resources and government support are sparse. Older adult hunger is at crisis levels. Congregate meals at older adult centers have been severely impacted by rising food costs. The city must invest at least $57 million in new funding for congregate meals, including restoring prior cuts and addressing inflation. Additionally, home-delivered meals, which are often the sole food source for homebound seniors, must be expanded with the council member Linda Lee's Intro 770, which ensures meals are provided 7 days a week. We also urge the council to support Councilmember Hudson's Intro 237, restoring grab-and-go meal options at older adult centers. Beyond older adults, several UNH members rely on funding for the Community Food Connections program, which plays a vital role in combating food insecurity. For example, WEDCO's weekly community food pantry serves approximately 65 households per week and 3,400 individuals per year. Providers have emphasized that sustained or increased CFC funding is critical to meeting the growing demand for emergency food assistance in their communities. UNH thanks the council for putting the expansion of CFC to $100 million to sustain and grow the program in your budget response. Additionally, UNH urges the council to support our ongoing efforts to create a SNAP for All program at the state level, which would utilize state funds to provide food benefits to low-income New Yorkers who are currently ineligible for SNAP due to solely their immigration status. Food is a basic human right, yet the federal government has failed to uphold it, slashing critical food assistance programs at a time of unprecedented need. Our most vulnerable neighbors shouldn't be forced to choose between rent or food. The city must take action to protect residents by ensuring our local food and rental assistance programs remain fully funded, accessible, and able to meet growing needs. Please see my written testimony for more. Thank you for this opportunity.
Thank you, Deputy Speaker Ayala, for the opportunity to testify today. My name is Jeanette Estima. I'm the Director of Policy and Advocacy at City Meals on Wheels. City Meals works to ensure that homebound older New Yorkers have the food they need to safely age in place, something we all want to be able to do. Thank you. Last year, our research showed that for 60% of older adults participating in the city's home-delivered meals program, the one meal a day they receive is simply not enough. Our meal recipients are not able to regularly get to a grocery store or prepare their own meals, which means that SNAP, food pantries, and other food programs are not always accessible to them. It's critical we look at ways to expand and modernize existing food programs and create new programs that bring more food directly to older adults in new ways. City Meals piloted new programs this year, a breakfast box to provide a second meal, and a mobile grocery program that allows an older adult to order a bag of food with a few options to choose from through a phone ordering system. This innovative pilot is being done in partnership with WISCA, and funding like CFC is critical in supporting organizations like ours working together to expand access to nutritious food to the city's most vulnerable residents. So thank you for including $100 million in CFC in your budget response, and we hope to see that included in the budget. We also urge the council to pass Intro 770 with $20.6 million to fund in funding to ensure that the Home Delivered Meals program provides a meal 7 days a week instead of just 5 days a week, and to increase reimbursement rates for congregate and home-delivered meals to combat years of inflationary cost increases. Thanks again for your partnership.
Thank you, Deputy Speaker Ayala, and the members of the Committee on General Welfare for holding today's oversight hearing on food insecurity and hunger. My name is Jenny Velos. I'm a policy associate at Citizens Committee for Children of New York. And since 1944, CCC has served as an independent, multi-issue children advocacy organization dedicated to ensuring every New York child is healthy, housed, safe, and educated. Low-income households continue to struggle with the high cost of not only food, but housing, childcare, transportation, and utilities. According to the State Comptroller's May 2024 report on food insecurity, households with children experience the highest rates of food insufficiency when compared to households without children. In 2022, 16% of households with children experienced food insufficiency, and although that number decreased to 15.1% in 2023, it was still higher than the 10% of households without children.
With New York City potentially losing $870 million a year if proposed federal SNAP cuts go into effect, it's even more important to invest in the resources necessary to alleviate food insecurity among children and families. Programs like Community Food Connection are a vital resource for families needing that extra help in accessing healthy food options. CFC and other food initiatives play a crucial role in ensuring families have the nutrition and supports that they need. So we applaud the Council's budget response of including increased funding for Community Food Connections to $100 million and baselining that funding. We also recommend the following investments: increasing funding for free health bucks and creating a $5 million food justice fund. And I just want to say, I think we can all agree that making sure that children and families are fed should not be a controversial issue, and we should not have to advocate every year for funding to make sure that New York City's children and families are fed. So thank you.
I agree. Thank you all so much for coming in to testify today. It's a pleasure working with all of you, and yeah, we have a big fight ahead of us. Thank you. The next panel will consist of Martina Santos, Isaac, Isaac, I can't. Anderson? I can't. Olderstein? He left, Isaac? Okay. D.B. Praya? Chatterjee? Yeah, okay. Leah Eden? You have what you... You may begin, whichever one of you wants to go first on either end. You want to start? ¿Quieren empezar? Okay.
Thank you, Chair Ayala, for your leadership today. My name is Leah Eden. I'm the Executive Director of Equity Advocates, where we build the capacity of food justice leaders from across New York to advocate collectively for a strong, sustainable food system. We also lead the New York City Food Policy Alliance, a network of 60+ local food systems groups that we have had the honor of convening for the past 5 years since those early pandemic days. You've heard the stark figures. Food insecurity affects every borough, every demographic, but it does not impact all New Yorkers equally, right? Communities of color and low-income households bear the brunt of this crisis, and failing to fund emergency food programs only deepens the racial and economic disparities. This is why we're calling for $100 million in baseline funding for Community Food Connections, and we really applaud and thank the City Council for your leadership and recognition that now is not the time to scale back our city's investment in this program, as was outlined in the mayor's preliminary budget proposal. We also urge the council to continue to champion and invest in local food economies that build wealth in communities, specifically investing in creating and expanding market pathways for small and historically marginalized farmers, while increasing access to locally sourced food in public institutions. There's been some really great progress in this area, particularly in schools and hospitals, but dedicated funding and technical assistance and connection is required to support our local farmers and growers and producers in meeting procurement contracts. We also call for increased funding for health bucks, as well as Get the Good Stuff, to make healthy food more affordable for more New Yorkers, while continuing to leverage federal GusNIP funds to maximize those resources. And finally, and thank you, Chair Ayala, for asking this question earlier today, we also urge the creation of a $5 million food justice fund for community-led projects that are designed to grow food justice and build wealth in BIPOC and low-income communities, as outlined in the Food Forward New York plan. We are happy to discuss that more offline. Thank you.
Thank you.
Thank you, Chairperson Ayala.
and to everyone in the committee. My name is Debbie Priya Chatterjee, and I'm a senior economist with the Community Service Society of New York, a long-time nonprofit dedicated to improving lives of low-income New Yorkers. Today I'm here to discuss the severity of the food insecurity landscape and suggest policy recommendations. Per our annual survey of housing and economic security, what we find that almost a quarter, 24% of New York City residents experience food insecurity, defined as skipping meals or enduring hunger due to lack of food, or reaching out for free food at food pantries, meal programs, or soup kitchens. For low-income households with incomes below 200% of the federal poverty line, the rate is higher at 38%. And even for someone who is employed and working full-time, 1 in 5 are struggling to put food on the table. As you would expect, these differences are not uniform. Black and Hispanic households are much more likely to endure food insecurity than their white peers. The National True Cost of Living campaign, which is a joint effort by CSS and FPWA, commissioned the Urban Institute to estimate how much a household really needs to get by. And they estimate that the annual food cost for a household with children and no seniors is around $14,600. And based off of their numbers, almost 62%, so that's 2 out of 3 New York City families are struggling to make ends meet. When you look at households with children, the rate is around 74%. When in our survey we asked folks, if you didn't have to pay so much for housing, what would you use the money for? The overwhelming response was to spend it on food. We would strongly urge the council to pass and make the benefit system more accessible by passing intros 0245, 1028, and 1148. Our survey shows that 15% of all potential recipients lost benefits in the past year due to incomplete or incorrect paperwork and missed application deadlines. In addition to reiterating all the asks from our collaborators, from whom you have been hearing throughout the day today, I would also like to mention that as proposed tariffs go into effect, typical New York households will lose up to $1,200 to $2,000 in purchasing power, and here we need the city and the city council to amp up its efforts to make sure the losses to our city is not as devastating. You heard that we will lose around $1 billion every year in SNAP benefits, so this is where we would urge the council to recognize the moment for what it is and invest heavily to improve nutritional security. Thank you so much.
Good afternoon, everyone. Good afternoon, Ms. Ayala. Thank you for having me here for the second time today. I'm going to read my testimony to you, and I want to add it when I finish a little bit more, if you let me. My name is Martina Santos, and I'm volunteer in Westside Campaign Against Hunger. Thank you for giving me the opportunity to present my testimony. Currently attend the Westside Campaign Against Hunger Food Pantry, a customer, volunteer, and a board member, over for 15 years. Where I come to a customer because I have a low income. I cannot afford to buy some food, fresh fruits, and some vegetables. Immediately when I went to Wisca, I see the qualify with the food, the distribution to the customer. That day I went home with smiley, through the fresh fruits and vegetables, protein, grain, meal. They be able to choose myself during my visit. The experience they bring me to be able to choose my fresh fruit and vegetable. It's like when I'm going to the supermarket. Wisca had come for me almost immediately. For my first visit, I'm becoming a volunteer pantry. Wisca mission is, I'm nervous, you know me?
Go ahead.
Wisca, the distribution of 6 million pounds healthy food, 110,000 families. For the example, 7 years ago, Wisca have only 1 point distribution point. Now we have 30 distribution point delivery directly to 2,000 homes. My great satisfaction to being able to a family, neighbor, friend and a stranger. Wisca becoming now Wisca, they show to the customer empathy treatment when they come into the pantry. Wisca volunteer, we have able to feel to really hungry to need to the existing city. And for me it's a pleasure to be able to do this job. It's not to do this job, because no New Yorker going to bed with hungry. In 2004, Wisca, which was at 600 point a million. It was 125 fiscal year for food pantry. I'm nervous. We support to and service to our community across the New York City. This here and here too, let it know you, Ms. Ayala, to helping to fighting for the CFC to bring the budget back to others' pantry, because the sad part for me is sometimes I'm going home with a broken heart, because I see people in the street and heard the conversation, how they be a struggle to pay rent, buy medicine, pay electricity bill. All these things, I'm struggling too, because I'm a low income too, and I be in the food stamp line. So I appreciate it if you and your team keep continuing with the hard working, and God the blessing you to helping us to get the budget back, to service to our customer with dignity like they be deserving, because sometimes I don't have enough money and I need to eat, like I don't be embarrassed here, to eat rice and bean in the evening because I don't have enough meat, and this rice and bean, they increase my sugar. I'm suffering for high blood pressure too, and that's what I'm here, to hear my voice, you know, and begging to you to do something for us, the food pantry, because that's not only me, that's my community living pantry to pantry, and food insecure. They grow like a monster, not only in New York City, around the world. And no New Yorker, they supposed to skip a meal, because if they eat breakfast, they don't eat lunch. They save it for going back with something in the stomach. And that's really sad, Ms. Ayala. We're living in the capital of the world. And this is the heartbreaker for me. Thank you very much for listening to me, and have a wonderful afternoon, every single body. And discúlpame, Ms. Ayala.
You did so
Estoy muy
good.
nerviosa.
No, you did so good.
Thank you.
Thank you.
Thank you.
Thank you. Thank you, ladies. Our next panel will be Marcus Jackson, Liz Ward, Alex Hughes, and Alex Malecchio. Okay. Okay. Any one of you on each, whatever corner wants to start first. You want to start? Okay.
Good afternoon, Chair. There we go. Good afternoon, Chair Ayala and staff. My name is Liz Ward, and I am a program assistant at the New York Health Foundation. The New York Health Foundation is a private, independent foundation that seeks to improve the health of all New Yorkers, especially people of color and others who have been historically marginalized. Since 2014, we've invested millions of dollars in supporting programs and policies that connect New Yorkers with the food they need to thrive. Despite considerable investment, food insufficiency remains a serious concern for millions of New Yorkers. Nearly 1 in 5 Black New Yorkers and 1 in 7 Hispanic New Yorkers experienced food insufficiency last year, compared with 1 in 11 white New Yorkers. Recent federal cuts make city investment in stronger safety net programs all the more critical. Just last month, the USDA cut more than $1.6 billion from food banks and schools. The agency also paused $500 million for the Emergency Food Assistance Program, meaning shipments of essential foods that were destined for food banks will no longer arrive. In New York City alone, 2.5 million meals are at risk. We are in full support of others' calls to continue investing in the Community Food Connection Program. We also believe the city must pay service providers on time. More than $4 billion in federal aid supports the work of nonprofits that are essential to New York City's safety net, yet many providers are still waiting on overdue payments. Federal cuts threaten their financial stability, so the city must honor its commitments and quickly pay them what they owe. Finally, we encourage the council to use its collective voice to oppose harmful federal cuts. To conclude, we are grateful for the city's shared commitment to ensuring all New Yorkers have reliable access to the nutritious food they need to live healthy, dignified lives. Thank you.
Angie Vega?
Yes. Thank you. Good afternoon, members of the committee, and thank you for the opportunity to speak with you. My name is Angie Vega, and I am the Assistant Director of the Children's Health Fund, the Healthy and Ready to Learn initiative. Today, I will speak about the importance of the continued and increased funding for programming that critically supports schools and parents, ensuring that students are well positioned to thrive in schools, like our New York City Council funded program, Healthy and Ready to Learn. According to the New York City Office of the Mayor's Food by the Numbers annual report, over 1.2 million New Yorkers are experiencing food insecurity. Moreover, 40.2% of adults lived in a household at risk of food insecurity in 2023, continuing a rising trend. Across the 5 New York City boroughs, the percent of children experiencing food insecurity ranges from as low as 14.2% in Staten Island to as high as 33.2% in the Bronx. In all counties, Black and Hispanic Latino individuals make up the majority of those who have limited access to quality food. Child food insecurity is linked to a number of adverse outcomes: development interruptions, school behaviors, and academic problems, physical alignment, including reduced immune system function, worse body weight outcomes, and asthma and mental health conditions, particularly anxiety and depression. Children facing hunger may struggle in school and beyond. They are more likely to repeat a grade in elementary school, experience developmental impairments in areas like language and motor skills, and have more social and behavioral problems. And this is why the New York City Council continued support of the Children's Health Fund Healthy and Ready to Learn program is extremely important. Healthy and Ready to Learn was developed by the Children's Health Fund in 2014 as part of our mission of supporting kids so that they can thrive. It was developed recognizing the importance of education and helping kids to reach their potential, and that they be the healthy themselves to take advantage of educational opportunities. The program is designed to help schools identify and address health barriers to learning rooted in social, racial, and economical inequities that impact student learning. When we have their health needs met, they're able to be better learners and succeed in school, ultimately translating into a likelihood of a productive and happy life. Healthy and Ready to Learn started with a strong focus on screening and responding to what we call health barriers to learning, such as addressing medical issues like asthma, dental, vision problems, and mental health well-being. While we continue to address these health barriers to learning, we are focused more on the worrisome needs of food insecurity and childhood trauma. HRL therefore has evolved to include connecting families to local food banks and other community resources to ensure that families' food security needs are addressed so that their children could thrive and reach their full potential. Through our current model, we leverage finding our flagship school, PS49, in the Bronx and in Councilwoman Diana Ayala's district, to inform materials and training that conducted with educators, administrators, and parents citywide, and through our Resource and Training Center, which was launched in 2017 as an online platform that enables Children's Health Fund to scale our impact to reach students throughout New York City. Our online repository is equity and diverse focus and houses a broader library that includes infographics, fact sheet, interactive learning images, slide decks, and external resources links. Here is a snapshot of our Resource and Training Center and HRL's impact.
Jenny, do you have a lot left? Because if you could also submit the full testimony for the record.
Okay. We just wanted to give you a snapshot of the impact, but we want to thank you for allowing us to testify today and to continue to have your support so that we can continue to support schools citywide, and hopefully we can expand into more schools and provide these services to them.
Thank you. Make sure that you submit that to us. Make sure to submit that to us.
Okay. Thank you so much.
Hello. Thank you, Chair, for holding and the General Welfare Committee for holding this meeting and hearing our testimony and, frankly, our cries for help. My name's Alex Hughes. I'm the Senior Director of Hunger Prevention and Advocacy with Project Hospitality, one of the largest social service providers on Staten Island. I've been with this agency since 2016 doing life-saving work. I know what it is to be hungry and how it feels to have nowhere to turn, and it's not something that I would wish on anybody. We're here as the collective canary in the coal mine. Emergency food programs, whether food banks or food pantries, soup kitchens, funders, all of us, we're all feeling the heat. And to put it as simple as I can, we're all seeing services go up, utilizations go up, the lines get longer, with the resources to tackle it dwindling in front of our eyes. And a critical program in this is the Community Food Connection Program. Without this program, the 30,000 folks plus that we serve annually on Staten Island would suffer. The reality is that the work, and thereby the people that we serve, are under attack with reckless and inhumane public policy decisions at the federal level of our government. SNAP, WIC, Medicaid, TFAP, school meals, and the list goes on. We all know that these programs work, and these programs are still under siege. When the USDA cut the LFPA program that was mentioned earlier, they said in a statement that these programs no longer effectuate agency priorities. In the face of that, I want to say that our drive and our commitment to this work will always remain an unwavering priority. We always want to do more. It's not a matter of want, it's a matter of having the proper amount of resources to make the work happen. I implore the committee, the council, please continue thinking of the hungry. Think of the children who are missing school meals. Think of the single mother or the single father who skip meals so their children can eat. Think about the person struggling to choose between health care, between housing, and between food costs. One way that we can do this, and as other orgs here are saying, is to increase that CFC baseline to 100 million. No, this won't bridge the gap, but it really could soften our landing as we work not just to serve meals, but to end hunger. In a time of discussion about priorities and what should and what shouldn't be cut, please don't forget us, our work, or our people. As we all know, in the hardest of times, New Yorkers band together and we lean into each other for support. Now is the time that we have to do this. We have to do this as organizations, as individuals, and as professionals. The time is now. Thank you.
Good afternoon, members of the General Welfare Committee. My name is Marcus Jackson, and I serve as the Aging-Friendly Community Officer for Encore Community Services. Thank you for the opportunity to speak today on food insecurity among older adults. Encore operates one of the largest home-delivered meal programs, more than 750,000 meals annually, to older adults who are homebound, medically fragile, and often entirely alone. For many, the meals we deliver is their only source of daily nutrition. But the city currently only funds one meal a day for 5 days a week. This leaves thousands of older adults hungry over the weekends and undernourished every day. We're urging the council to expand meal funding to provide 3 meals per day, 7 days per week, to every older adult who needs it. We also need reimbursement rates that actually cover providers' real costs. Food prices, labor, and delivery expenses have all increased, but funding hasn't and has kept the same throughout. Without action, providers like Encore will be forced to make impossible decisions about what we can and can't afford to deliver. Finally, nutrition is only one part. Our financial case managers help older adults apply for SNAP, manage healthcare bills, and access rent relief. They're essential to preventing hunger before it starts. Expanding funding for financial case management must be a part of the city's hunger response. Encore has been serving older adults for nearly 50 years. We know what it takes to prevent hunger, and it starts with fully funding the programs that work. Thank you for your time and for your commitment to this issue.
Thank you. Thank you all for your coming by and lending testimony to today's hearing. Thank you. Our next and final panel consists of, in-person panel, Genevieve Braun Ross, Christopher Leon Johnson, and Sharon Brown.
Ready?
Yeah, you can begin.
Yeah. Hello, Chair Diane Ayala. My name is Christopher Leon Johnson. I'm here to support people that are hungry in the city of New York. The issue is that it's a lot of grandstanding that's going on with the city council and these nonprofits, that they love to serve nasty food to the people. They don't serve healthy food. I don't know what's going on with that. The city council need to start supporting more healthy food giveaways to the people that are poor. Instead of just giving away nasty GMO processed foods, they need to start pushing more for healthy foods. If you give people healthy foods, it will solve the issue with the hunger crisis, because healthy foods last longer than unprocessed foods. But the thing is that these nonprofits only care about getting their money lined up, and the way to get their money lined up is through these organizations and these donors that are backed and work hand in hand with these GMO food organizations. So it all come in hand, and this is all about medical research on the people that they know they can exploit. And what I'm talking about is the working poor. If you give them nasty food, they get sick, and who you think that benefits? It's the corrupt insurance companies and the corrupt hospitals. And everybody know that the hospitals and the insurance companies fund majority of these nonprofits and fund our Speaker of the City Council and our zoning chair, Kevin Riley. So this is all about research. This is all about exploitation of the poor, and that's all it's about. There is a hunger crisis. There is a food shortage, but there's a way you need to solve this by allocating more money into the foods and give it directly to the people, instead of relying on these nonprofits that just see these people as photo ops and photo opportunities and exploit and allow them to just see them as like, oh, if we get these people sick with the help of the hospitals and the nonprofits and the big donors, they make money off the sick people. So this is nothing but a pipeline. I call the sick, the hungry to hospitals pipeline. This is what it is. It's all about getting these people sick. That GMO foods, it gets you sick. So I say this right now, support, we need to support, but it need a lot of change in the city. It needs a lot of change. And I feel bad for the people that, that are hungry, that needs food, that don't have the opportunities that I do to try to make some money. But they rely on these food banks and these food pantries to sustain themselves. But if you go to a food pantry or any food bank or any food giveaway, like they give you disgusting, nasty foods that don't last that long. Some of the food expired. They have black marks on the bananas, but that's all done on purpose because these big time food distributors don't want the food and they know who to give it to, and these nonprofits don't care because they see, oh, we give out 20,000 boxes of food in one day to the people that, especially like Corona or Elmhurst or Jackson Heights. You know, they stay. You know, it looks good for the photo op, and some of these people that run for city council, they love that stuff. I know. I know this stuff.
Christopher, I'm sorry. I let
Yeah.
you go. I let you go over. Do you think that you can submit the rest of your?
Yeah. I
testimony?
can.
All right.
Yeah.
Thank you, honey.
Thank
you
you
for coming.
Thank you.
Sharon.
Hello, my name is Sharon Brown from Rose of Sharon Enterprises. Before I begin, remember the hostages, release the hostages, let Yahweh's people go, defend Israel. Okay, for general welfare, as far as the food is concerned, I am still concerned about the shelters. They were giving out spoiled food at specific shelters. I want to know if there's going to be some kind of follow-up on that. It was like maybe 6 months ago. 6 months before that, they were saying it was a problem. We came back, it was still a problem. They were giving out spoiled food at the shelter, so I hope that's being taken care of. I want to make not-for-profit sit in restaurant chains and grocery stores, not-for-profit. I hope other people do that. Just regular restaurants, all different varieties, Mexican, Chinese, anything, but just up to standard. And regular grocery stores, bodegas and things that give out food that free. And we need to try to coordinate with the grocery stores they have now, the grocery stores, the restaurants and stuff, the people that don't sell out the groceries, and they always wind up with a backlog of food getting spoiled, just sitting there. Maybe they can coordinate and have people come in and shop before all that food goes spoiled, or they can do charitable giving. So when people are in need, you can get people to coordinate with certain grocery stores. They can go there and they can shop, and then they can do some kind of tax write-off. They can get some kind of benefit. Maybe somebody can organize that, myself or something. We need prayer in school. We need prayer. We need the Bible. We need the Ten Commandments in school. We need to make sure that all the students are fed, and they can coordinate with the schools and the grocery stores and stuff like that. The school, just a few more minutes. The parents that don't have food at home, but they do have food at school, maybe we can coordinate with the restaurants and the grocery stores that when they're doing bad and they're not selling, they can coordinate with the schools and the families to give food to these families, let them shop, and they can do it as a tax write-off, charitable giving or something. And just Rikers Island needs to be closed. Thank you.
Thank you so much for coming, Sharon. We have now heard from everyone who has signed up to testify. If we have inadvertently missed anyone who would like to testify in person, please visit the sergeant at the sergeant's table and complete an appearance card now. All right, we are making a final, well, sorry. I skipped. All right, we will now move on to our Zoom portion of the hearing. William Flynn.
You may begin.
We can't hear you, William. Hold on. Are you muted? No, we can't hear you. I can see you. Okay, so we're gonna move on to the next person and we'll come back to you while you figure out. Adriana Beltran.
You may begin.
Okay, we're taking a quick pause to just check on our end, see if the issue's with us. Okay, all right. We're gonna go back to William Flynn. Try now.
Begin.
Good afternoon. Can you hear me?
Yes.
Oh, great. Okay. Thank you. I know it's been a long day. Chairperson and Deputy Speaker Ayala and members of the General Welfare Committee, thanks for the opportunity. I'll be really brief. My name is Bill Flynn. I'm the Director of Government Benefits Unit, the Disability Advocacy Unit, the LGBTQ plus HIV Advocacy Project, and our Veterans Justice Project at Legal Services NYC in our Queens office. I'm here today to speak to INT 1148, introduced to this body in December by Councilmember Caban, and how it will benefit and help our most vulnerable clients and your constituents. The units I supervise intersect disproportionately impoverished communities we both serve. We at Legal Services NYC are very encouraged by the amendments offered by Councilmember Caban's bill. Too many times we meet clients who seek our help, who have been denied services from the Department of Social Services or HRA, sometimes multiple times, for failure to provide the information documents needed to complete an application for services, only to discover that the client had provided the requested information numerous times, delaying the much needed assistance that our clients and your constituents are seeking to help with in the first place. We've requested fair hearings to appeal these such decisions. On a recent case where I represented a veteran living with a disability who had lost a part-time employment, just needed to adjust the income with HRA to adjust the rental assistance he would be entitled to going forward. He was denied 2 times for not providing the requested information to adjust this rental assistance. He came to LSNYC. We requested an expedited fair hearing because of the delay was putting his housing in jeopardy. The agency sent me an evidence packet prior to the hearing, which contained all the documents, not surprisingly.
Your time has expired.
As it'll help our clients and navigating these systems, and I encourage you to refer your clients to our agency for assistance in navigating these clients as well. Thank you.
Thank you. Thank you so much. Adriana?
You may
Beltran?
begin.
Adriana Beltran?
Good afternoon. Good afternoon, Chairperson Ayala and members of the committee. My name is Adriana Beltran. I serve as the Deputy Director of Woodside On The Move. I have worked with Woodside On The Move for over a decade, and I have been serving Queens residents during my tenure with Woodside On The Move. In my role, I oversee and manage all the programs, including grants and contract management, ensuring that the services are met for the community. Through my years at Woodside On The Move, I had the privilege of assisting countless community members, particularly seniors, in applying for critical benefits such as housing, Medicaid, and SNAP, programs that are essential to their daily well-being. However, I have repeatedly witnessed systematic inefficiencies that create unnecessary barriers to accessing their services. One of the most persistent challenges our clients face is the lack of a clear and consistent application process. Many applications are delayed due to the prolonged processing times or disorganized case management. Applicants frequently find timeless having to submit their documentations multiple times due to the loss or on-track paperwork, causing them undue stress and delaying the assistance that they deserve. For example, one of our longtime clients, a senior woman who has been receiving assistance for 14 years, relies on WADON to renew their SCRI and SNAP services. While she has benefited greatly from these services, she has expressed delays in receiving renewals applications from DSS, leading to disruptions in her benefit. Fortunately, our case managers at Woodside On The Move has been able to advocate on her behalf, ensuring she does not lose access to those critical resources. However, not all individuals have access to the advocacy and support she does, leaving many struggling through the system. Intro 1148A.
Thank you. Time's expired.
You can wrap it up.
Okay.
Yeah.
Okay.
Thank
It's necessary to step toward addressing the systematic issues by requiring DSS to provide a receipt for applications. This bill ensures transparency and accountability in the application process. A receipt will offer applicants clear documentation of their submission date and records of the materials received and guidance on completion of application. This simple yet crucial measure will prevent unnecessary delays, reduce stress for applicants, and provide access to essential services for the city's most valuable residents. Thank you.
Thank you. Next, we will hear from Stephen Grimaldi.
You may begin.
This is just me sort of touching base with you and getting a sense of who you are.
Hello, Stephen Grimaldi.
I would love it. That's what Stephen. So I'll discuss the position, right? So you're interviewing for a full-time driver position.
Okay. We're moving on to Saeed Buyan.
You may begin.
Okay. What is that?
Hello. I don't think there's a Saeed Beyond, but I'm here to testify. Should I begin? I think I was just unmuted.
Okay. Are you Andrew?
Yes. Hi.
Andrew Anna?
Yes, Andrew
Okay.
Santa Ana.
Okay.
Okay, I'm going to begin. Hi. Thank you, Deputy Speaker Ayala, for holding this important, very timely hearing on food insecurity. My name is Andrew Santa Ana, and I'm the Interim Co-Executive Director at the Asian American Federation, representing the collective voice of more than 70 member nonprofits serving 1.5 million Asian New Yorkers. Food insecurity in New York's Asian communities has reached a breaking point from a combination of federal cuts, escalating anti-immigrant policies, fears of folks jeopardizing their status because of public charge, and of course, the wild shifts in the prices of food and the economy from tariffs have created an untenable situation. And so despite the model minority stereotypes surrounding Asian Americans as wealthy and successful, our communities face significant hardship. So while there has been population growth in our community, 1 in 3 Asian residents lives in low-income households, and they're twice as likely to experience poverty relative to white New Yorkers. And currently, 42% of Asian older adults are low income, making them amongst the poorest seniors. And so what we hear from our communities about food insecurity is alarming. Our member organizations rely on federal, state, and city sources to feed their communities, and the potential cuts are terrifying. Food pantries that are funded under TFAP and EFSP and folks that seek assistance through SNAP, these cuts are going to be devastating to the Asian communities. And so while we recognize that the City Council is doing its best to show up for our communities and protect the line, I wanted to share how this is impacting our communities, because what we're hearing is that folks are fearing accessing food pantries because of ICE raids. People are disenrolling from benefits. And of course, they're still subject to some of the perennial scams, such as like their benefits cards being skimmed and compromised. And so when all of these things come together, we want to make sure that our communities that are doing that work in community to make sure that people are fed is resourced. So again, we believe that it's important, more important than ever, that we continue to reinforce these supplemental supports for our communities. And that looks like a couple different things. Of course, continuing to fund the groups that do linguistically and culturally competent food services that provide alternative food benefits for the immigrant community, the Asian community, and particularly older adults. And that, of course, includes continuing to fund that culturally competent in-language, non-traditional service models that are often that space that provides that access point for older adults and food insecure people when they're often afraid to access other programs. Listen, I know that there are not easy answers to these questions and the challenges are complex, and your leadership and ongoing leadership in this space has been very vital. And I'm going to submit more details online. Thank you so much for your time.
Thank you. Thank you so much. Pernell S. Bryce.
You may begin.
Thank you, Deputy Speaker Ayala. My name is Pernell S. Bryce III, and I'm the Vice President of Policy and Advocacy for Children's Health Fund. And today I'm here to speak on behalf of children and families of New York City who are struggling with hunger and food insecurity. As a city of great wealth, it's deeply troubling that so many of our neighbors, particularly our children, go to bed hungry or lack consistent access to nutritious food. The statistics surrounding hunger in New York City are staggering and unacceptable. According to recent data, 1 in 5 New York City children, approximately 400,000 kids, are food insecure, meaning they do not have consistent access to enough food for an active, healthy lifestyle. Nearly 1 in 4 families with children in New York City experience food insecurity, with rates disproportionately higher among families of color. The poverty rate in New York City is approximately 18.9%, but for Black and Latino children, the number is nearly 30%. These figures are not just numbers. They represent real children, families, and communities who are facing daily struggles to access basic sustenance. Hunger affects a child's ability to learn, grow, and thrive. Food insecurity is linked to development delays, poor academic performance, and long-term health problems. No child should have to worry about their next meal and where it will come from, as the city is prosperous in New Jersey, as in New York City, sorry. We ask the City Council to continue to fund necessary food assistance programs like SNAP to ensure that all New Yorkers, particularly children, have the sustenance that they need to be successful. Thank you so much.
Thank you. We want to move on to Barbara Hughes.
Sorry. My name is Barbara Hughes. I'm the Executive Director of City Bee Kitchens at Project Renewal, the New York City Homeless Services nonprofit agency. Thank you for convening this hearing. For over 55 years, Project Renewal has provided shelter, housing, healthcare, and employment services to New Yorkers experiencing homelessness. We are grateful to the City Council for its ongoing support of our programs. We are proud to have partnered with the city to address some of the New York's biggest challenges, including food insecurity and hunger. More than 1.2 million New Yorkers are food insecure, with over 1.8 million receiving SNAP benefits, and countless others relying on approximately 400 food pantries and 80 soup kitchens throughout the city. We are encouraged to see that the General Welfare Committee is prioritizing legislation to make it easier for New Yorkers to apply for and receive benefits from food assistance programs. City Bee Kitchens, which I oversee, is a social enterprise that plays an integral role in combating food insecurity throughout New York. As one of the largest food providers to New Yorkers in need, we serve 2.6 million meals each year at shelters, supportive housing, and senior centers across the city. Beyond our catering services for events and meetings, we prepare meals for people living in shelters and for other nonprofit organizations. We also organize food drives and special holiday dinners to ensure families don't go hungry during the holidays. And our culinary arts training program provides New Yorkers facing barriers to employment, including veterans, with world-class culinary education and pathways to fulfilling careers. Many graduates secure positions in corporate kitchens, local restaurants, and within City B Kitchens itself. We've witnessed the powerful transformation of New Yorkers who have once faced employment barriers and are now working full-time to support others facing similar challenges. To sustain and expand City B Kitchens and our culinary training program, we rely on city investment. We thank the council for its continued support of our programs, and we applaud the priority this committee is placing on alleviating food insecurity in our city. By investing in nonprofit food providers and facilitating access to SNAP and other food benefits, the council plays a vital role in addressing this hunger crisis in our city. I recently came across a quote that reminds me of everything I've heard today, which is, "Democracy is a sham in the presence of hunger." Thank you for the opportunity to testify today.
Thank you. Our last person is Jacob Zaitchik.
You may begin.
Thank you so much to Deputy Speaker Ayala. On behalf of the American Heart Association, thank you for the opportunity to provide public testimony about hunger and food insecurity in New York City. Heart disease is the leading cause of death for adult New Yorkers. A healthy diet and lifestyle are keys to preventing and managing cardiovascular disease. Unfortunately, too many New Yorkers lack access to healthy foods. First, I'd like to thank all the fantastic organizations and advocates today who are doing incredible, meaningful work to address hunger by providing meals and food to those in need. Thank you so much. The American Heart Association is supportive of increased funding for two specific programs that will address nutrition, hunger, and food insecurity in the city. The American Heart Association is supportive of increased funding for Health Bucks, New York City's nutrition incentive program, and also for Get the Good Stuff, a program where every dollar you spend using SNAP EBT on eligible fruits, vegetables, beans, and other products is matched up to $10 per day. Once again, I want to thank everyone today for all their great work to address hunger in the city, and thank you so much for this opportunity to provide public testimony. Thank you.
Thank you. All right, we are making one final call for Zoom registrants who have not yet spoken. Okay, seeing none. If we have inadvertently missed anyone who would like to testify virtually, please use the raise hand function in Zoom, and I will call on you in the order of hands raised. Okay, seeing no one, I would like to note that written testimony, which will be reviewed in full by committee staff, may be submitted to the record up to 72 hours after the close of this hearing by emailing it to testimony@council.nyc.gov. With that, this hearing is concluded.